Lifestyle diseases such as diabetes, hypertension, obesity are on the rise. By using physiological
and a proponent of muscle-centric medicine and lifestyle medicine. He is third done black belt in WTF Taekwondo. He is actively collaborates with organizations like Sports Authority of India, NERC Imphal, various sporting teams and athletes to promote health and fitness for optimal performance and faster recovery. He has numerous national and international indexed publications. He was conferred Devraj Bajaj Research Award 2021 by APPI and received fellowship of Indian Society of Chronomedicine, FISC. I would ask volunteers to please guide sir on the stage.
White.
Hello. Thank you very much, Chairman sir, the respected faculties, Professor Mandal sir, Dr. Kunal sir, and all the dignitaries and my friends and colleagues for inviting me to this CME. So I will be speaking on, with the introduction of the lifestyle medicine and also the problem which we are facing because of the current lifestyle. It may be lifestyle disorder, or we can also known as a non-communicable disease, and how to counter that using different physiological technique. And also I will be touching upon the concept of the lifestyle medicine, the concept of the performance medicine, the concept of the sports and exercise medicine, and most importantly the concept of exercise as medicine, how exercise can be used to counter this disease, to not only to prevent it but also for the treatment and rehabilitation purpose. So can you please connect the slide? ओके, तो थैंक यू वेरी मच। हाँ, ये थोड़ा ढीला हो गया शायद। Right. Yeah. So I think now it's working. So exercise is medicine, prevention and treatment of different disorder of the lifestyle. I am Dr. Hanjabam Barun Sharma, sports and exercise medicine specialist, clinical and interventional physiologist, and I am currently the General Secretary of Indian Society for Sports and Exercise Medicine. So let's begin the talk. I will be talking under different heading, like for example, how to identify the problem which we are facing, like for example, the disease of the different disease of the current lifestyle, and what are the root causes. And after understanding the root causes, let's see how we can counter that by using the physiological intervention. Then I will be speaking about exercise medicine, the challenges which we face, in order to practice the different the physiological intervention, and also the scientific way in which exercise can be prescribed and targeting the different physical fitness component. And I will be talking about the muscle-centric medicine, countering the negative effect of the visceral fat, and I will be talking little bit about how to target say diabetes and hypertension and other diseases if time permits. So lifestyle disease is the problem what we are facing. Is lifestyle disease is not the disease where drug deficiency is there. So lifestyle disease means we have to counter by using the different lifestyle intervention, not by giving a different drugs. So medicine is not the answer. Drugs are not the answer. The answer is the changes in the lifestyle, because that particular disease is because of the lifestyle. If you want to change that particular disease, counter this, you have to correct your lifestyle. So that is the message, because you cannot drug the particular person into being more healthy. You have to invest into health. You have to do exercise. You have to do adopt the healthy lifestyle. You cannot just take one pill and become more healthy. And you cannot blame upon the genetics also, because genetics may load the gun, but the trigger is pulled by your lifestyle. So epigenetic is very important. How to maintain the healthy lifestyle is important, because 90% of the illness which we are facing as a lifestyle is because of our stress and a lifestyle, not because of your genetics. Genetics, may have that underlying condition, but that it can only be converted into that particular disease because of the epigenetics. So that's why we have to understand what are the different etiology, what are the different causes of this lifestyle disease. And one of the most important causes is physical inactivity. Physical inactivity has been described as a pandemic since 2009 and 2012. And cardiorespiratory fitness, low fitness level, different type of fitness I will be talking. Low fitness level is one of the most important risk factor for any non-communicable disease. And you can see that, since 1965, so much reduction has been done there in case of the regular physical activity, be it a leisure physical activity, transport related, domestic, occupational related. So a gross reduction in physical activity is there. So we have to see. And if you see the Indian context, India is fifth among the South Asian countries regarding physical inactivity, and 15.6% of adults are physically inactive. And this physical inactivity is very important, because this is one of the root causes of so many problems, be it as a cardiovascular problem, be it a muscle related, that is sarcopenia, be it a central nervous system problem, the cancer related, it may be a metabolic problem, it may be musculoskeletal related problem. So physical activity has lots of problem is there. So if you want to target that particular different disease, you have to target the root cause. That root cause is a physical Pakistan and India, where how it is there. That means as compared to the Western population, we have South Asian phenotypes where we may have lower BMI. Because you cannot just suppress the symptoms. You have to, if you want to cure that particular thing, you have to target the root cause. And the root cause is mainly biochemical basis. If you understand, then hyperinsulinemia is one of the most important root cause, and the leaky gut syndrome is also there, where autoimmune as a non-communicable is high, and the chronic inflammation. And you can see that all three can be effectively targeted by maintaining an optimum lifestyle and the fitness. Because if you see the insulin resistance, it may be caused by many various factors, including the sedentary behavior, including the processed food and everything, and it has lots of problem. For example, sarcopenia, stroke. It can lead to type 2 diabetes and everything. So inflammation and this insulin resistance, insulin you are not in the face of the type 2 diabetes, but insulin hyperinsulinemia may be a problem. So if you want to the target you cure all this problem, including the cancer, then the prevention, you have to make sure of this insulin resistance and the chronic the inflammation. So 80%, more than 80% of the individual, if you see general population, they may be having a high instance of the insulin resistance, and it may be more than 50% in India also. And if you see the metabolically fitness, you don't focus not only on the physical fitness but also the metabolical fitness, and these are all different parameters which can we easily measure in any kind of the physiological lab, and we can see whether a particular person is physically metabolic fit or not. And you can see that the triglyceride level is very important. Triglyceride is more important than LDL cholesterol and total cholesterol. So these are the concept where we can target the insulin resistance. And further, if you want to go into the biochemical physiology, you see that the insulin resistance, cortisol, and because of the inflammation, lots of paper has been published, lots of citation is there, and these are the root cause. You have to target this root cause. It may be lipotoxicity in the form of the ceramide, lots of medicine, and that particular medicine may cause another symptoms which optimum health, because the doctor You understand this is a Christian burnout. He said that if he, he said 150 people with heart transplant, but if we focus on a dramatic care, then one people could have help. This is the first person to the heart the transplant. So, the sign of the good doctor is not that particular patient on drugs. He is the good doctor who remove the drugs, who remove the requirement of drugs by making that particular fit. Yeah. So a best doctor is the one who's preventing the disease from ever happening. And a great doctor is the one who treat the patient. So just become the best doctors. And in order to become the best doctors, you have to understand the concept that the body itself heals, naturally. The only thing is you have to remove the causative factor. The causative factor which I've already spoken. So that causative factors can be removed by using positive lighter, not by using say statin or Ozempic or the other drugs.
They may remove the symptoms, but the root cause, the primary cause, may still be there. So that's why a physiological concept is important, where the targeting of that particular patient care is the base of the pyramid is formed by the lifestyle intervention or physiological intervention, where we use different intervention. Like for example, we use the optimum nutrition, exercise, sleep, stress resilience, meditation, mental health, yoga, and all these things can be used under the heading of the clinical and interventional physiology. This is the definition which we give in the paper, and not only for the health and the fitness promotion, but also for injury and in this prevention, treatment, and rehabilitation. So different, the branch of the medicine has started. Like for example, functional medicine has recently started. They tends to focus on the root cause by using different intervention, including the supplement and also the lifestyle medicine with the different pillars. And if you see the pillars of the lifestyle medicine, where what are the pillars? Like for example, nutrition, physical activity, stress, coping, social connection. They're avoiding the risky behavior. Everything is there. So if you want to target that particular lifestyle disorder, then you have to touch upon all these pillars. And if you want to go above the normal, then you have to go into the performance medicine. The performance medicine is where all the concept of the lifestyle medicine is there under the physiological and the psychological tool. In addition to that, you have to focus on the technical and the tactical that is required for obtaining DOF-free performance optimization. Injury and illness-free, DOF-free performance optimization under the heading of the performance medicine. And in the performance medicine, sports and exercise medicine is one of the branches where we focus not only on the treatment, but also on the physiological. That means Citius, Altius, Fortius. You want to achieve that optimum performance. Not only we not only focus on the treatment and rehabilitation, but on the enhancing, stretching the physiological limit. So sports and exercise medicine is basically sports medicine and exercise medicine, where sports medicine we generally deals with the optimum human performance enhancement. And exercise medicine is where use of the exercise as a therapeutic intervention for treatment, rehabilitation, and prehabilitation of different injury and illness. So sports medicine, we generally focus not only on the sick patient, but also on the elite athlete. That means from sub-physiology to normal physiology to supra-physiology. So all this domain we have to see, and this is a definition of the sports and exercise medicine which we give, in the recently published paper. And what we require is always, exercise and physical activity not only for the health, fitness and promotion, but also for the medical and therapeutic use. Use of the exercise, use of the sports as a therapeutic, as a medicine, for optimizing health and performance. So that is the concept of the sports medicine. Why sports and exercise medicine is important? Why exercise is important? Because the answer lies upon the evolution. Because we as a Homo sapien, we evolved in the plain of the savannah by using what is known as persistent hunting. So movement is a medicine. If you don't move, if you are physical inactivity, you are basically against the evolution. The brain, the development of the brain is said to be, the produce adaptable and complex movement. So if you don't have the movement, then brain will not have been developed. So that's why it is very important, and a different fossil records are there which says that our ancestors, they were hunter-gatherer and a persistent hunting. We were evolved as a runner. So that's why movement is very important. And movement is not only important for the whole body, it is also important for your mental health, neurological health. And lots of mechanisms are there. I will not go into the detail. Like for example, BDNF is increased because of it causes a neuroprotection. Neuroplasticity has been increased. Cognition is increased. The depression and all that particular mental health problem is decreased. So exercise is one of the most important factor for mental health. It may be in some cases it may be equal to the medicine of the different drugs which we are currently using for anxiety and depression. And lots of biochemical messenger are there. It has been published well, and the point is, because of the different concept, it may be aerobic exercise, it may be resistant exercise, it may be concurrent exercise, combined exercise, everything affects your brain. So not only your physical health is improved, your mental health is also improved. So that's why we says that exercise is the most underused antidepressant. Food may be the most abused anxiety drugs. So we have also done different documentary regarding the exercise and the brain health. And the simple prescription of, say, aerobic exercise, like for example 3 to 5 times in a day, 70% to 80% of your heart rate reserve, say just 30 minutes of your day, may improve your signs and your symptoms of the mental health. So this one has to understand. So exercise not only improve your brain health, but also it involves whole system. It is the one things which you do which affect the entire body, entire cells. So exercise is, that's why exercise is known as medicine. It may affect not only the metabolic health, insulin resistance, metabolic health and everything is improved, but also the cardiovascular health, but also inflammation. Remember the 3-4 root causes of non-communicable diseases which I talk. They are all targeted by exercise. So exercise is so much important that the exercise 30% reduction of all-cause mortality can be achieved by you doing a regular exercise. It may be, for example, bone fracture can be reduced. Risks of the falling in the elderly can be reduced. Sarcopenia can reduce. Dyspnea can reduce. Sarcopenic obesity can reduce. Coronary problem can reduce. Colorectal cancer, prostate cancer, breast cancer. All this, can be effectively targeted by using exercise. And if you compare the exercise with different drugs, the different medicine which we are having, you can see that the different papers are there where you say that exercise is more beneficial, as compared to the even anticoagulant. If you see regarding the stroke, exercise is more this thing, and exercise is also comparable for coronary heart disease and for also the heart failure and everything. So exercise is well known the thing, and the problem is we don't use it. The doctor don't use it. The medical health profession do not use it. Exercise, lots of paper has been published. Like for example, 88% survival at 12 months is there for exercise in case of the coronary artery disease. 40% reduction in cardiac disease. Type 2 diabetes, 58% reduction type 2 diabetes. It may be superior or even equal to the drug or surgery in some case, but unfortunately, we don't use it. So the reason may be many things. One of the reason is they don't know, the medical health profession do not know how to use exercise properly as a treatment. That's why American College of Sports Medicine, they have launched this exercise medicine globally in 2007. And in India, we are planning to launch this exercise is medicine in India very soon, where we have to educate the healthcare professional how physical activity can be assessed, for fitness can be assessed as a part of your clinic, and how exercise can be used as a therapeutic intervention. So exercise is very important. Every mortality can be reduced by using exercise. Like for example, if you do both aerobic and strength training, then see how much reduction of hazard ratio is there in case of the, say, lower respiratory tract infection. For cancer also, it is reduction is the all-cause mortality can be reduced. Everything is beneficial. So not doing exercise, not doing a simple walking an hour is considered to be high risk behavior now, because so much beneficial effect is there for exercise. mortality of the cardiovascular disease is reduced because of the exercise. If you see the osteoarthritis also, how osteoarthritis is becoming very common, especially among the females because of the weight problem. If you see a regular exercise, then there is much reduction in the hip as well as knee osteoarthritis, and also loss of the cancer also directly related: colorectal cancer, breast cancer, endometrial cancer, kidney cancer, bladder, and all the stomach cancer. They are directly affected by exercise. So this the concept one has to understand. That's why the Robert Butler has says that if exercise could be back in a pill, then it will be the most prescribed and beneficial medicine in the whole world. So that's why this is the beauty of the exercise. Not only exercise, also sports is also a medicine. Like for example, football is a medicine. Football can be used as a medicine. You take football, you take kabaddi, you take cricket. Any sports event can be met as a medicine if properly given. It can be used to target the type 2 diabetes, cardiovascular disease, osteoporosis, and the risk of falling and everything. So that's why. But what is the challenge? Challenge is people don't want to take the lifestyle problem because they just want to do surgery and pills. That's all. Shortcut. हर कोई को shortcut चाहिए रहता है. Everyone wants shortcut. They don't want the lifestyle change. The change. That is the problem which we are facing. It may be because of different, because money may not be there. When you're sick, then money may be there. If it is not here, it is not here. But the problem is, if you see the healthcare spending, if you see the spending and a life expectancy, it is not linearly related. That means, like for example, USA has spent lots of spending on healthcare, but their life expectancy is not more. That means if you spend lots of money in the sick care, then your life expectancy may not be that much high also. So something is wrong because we are targeting wrongly, spending is wrongly targeting in that particular the sector where that is not the root cause. Like for example, like 50%, more than 50% of that particular your habit, your lifestyle, your exercise, everything is the causative factor. But we are focusing 88% on the sick care, not the health care. Pathology-centric approach is being followed rather than the physiology-centric approach. So if you, and another problem is we as a doctor are not fit at all. If you are having a central obesity and you prescribe nutrition to that particular patient, how will they do it? If because the general public also sees that a young doctor with a fit doctor, they say that it is an inexperienced doctor. If you see a huge central obesity, they say, seek a senior experience. So that concept has to change. So everything has to start from you. So regarding again the sports, coming back to the sports and exercise medicine, in the sports medicine what we do is exercise training has to be done. So how we have to target that problem? That problem can be targeted by using a scientific approach to training and prescription. Like for example, exercise training of how scientific approach we have to follow, and regarding the exercise prescription also what we have to follow scientifically, because we want to focus not only on the health but also for the performance, and we want to stay away from the pathology but focus more on the physiology. Illness and injury reduction with the dose-free performance optimization. That is the answer. And optimum cardiovascular health is what is required. Focusing too much, having too much high intensity exercise, we want to avoid the sudden cardiac arrests which are happening in the gym and everything. That we have to focus. A balance has to be approached, because optimization of risk-benefit ratio is very important if you want to prescribe that particular thing. Because that a Goldilocks zone where optimum amount of the exercise, optimum amount of the a particular major nutrient, like for example carbohydrate, that has to be followed. Excessive is never good. And just seeing the concept of the exercise training, like if you do too much of the acute exercise load as compared to the chronic load, for example, if you do acute means just 1 week before the before your session, if you do exercise, that considered to be the acute. And if you do 1 month, that is the chronic. That means chronic means your fitness. So if you don't focus on the fitness, if you suddenly do too much, then what will happen? Danger zone. That is, injury can happen during the exercise training. That's why too much too soon after too little for too long, that is dangerous. We have to start low and go slow. So that mantra we have to follow. And regarding the extreme exercise hypothesis, also, like for example, if you do high intensity exercise for a very long time in harsh condition daily, then exercise will not have that beneficial effect. That goes from the most beneficial zone to the most dangerous zone. So extreme exercise hypothesis is also there. One has to understand, because if you do too much, high intensity, then a little bit hazard ratio can also increases. And cardiovascular mortality can also increases for a short time. In fact, for coronary heart problem can also increase if you do daily exercise for a very high intensity. That's why you have to understand how much is too much. So that thing one has to understand. Just like precision medicine, where medicine is prescribed based upon the requirement, based upon the individualization principle. You have to do exercise prescription, exercise training on individualization principle. You cannot just say कि आप जा करके 30 minute walk करके आओ. That is not the scientific way. You have to write, you have to prescribe in a proper way, and for that exercise training principle, one has to understand, like SPORT, sporty. Specific exercise has to be specific, because specific demand to the adaptation to the imposed demand happens. So if you are not specific, then your goal cannot be specific. It has to be progressively overload. You have to challenge your physiology by giving adequate rest. Then only the adaptation can happen. And reversibility, if you don't give adequate stimulus, then what will happen? The gain will be lost. Then variation, it has to be vary. Otherwise, injury and illness can happen because of the monocytic, because of the overtraining syndrome, because of the, say, the overload. And individualization, very important. Each and every person is different. That's why you have to tailor that particular exercise based upon that particular intervention. And SMART goal one has to follow. Like just giving you an example, during the competition phase in the athlete, we generally increase the technique training, but we decrease the volume of the training. Otherwise, what will happen? Overtraining problem can happen. So that's why the variation has to be done based upon the scientific principle. Similarly, if you are, seeing a particular patient of the non-communicable disease, then you have to prescribe the exercise based upon the scientific principle of the fit. Like, for example, frequency. You have to say how many times a week or how many days, times a day you have to prescribe the exercise. How much is the intensity of the exercise? How much is the duration? What is the type of the exercise? What is the volume of the exercise? And the progression. If you give an exercise, one static, then you are not challenging your system. If you don't challenge the system, then adaptation will not happen. That's why progressive overload principle has to be followed. So by using this principle, you can follow different, like for example, resistance training, flexibility training, balance training, aerobic training, what you call the proprioceptive training can be given based upon this, the principle. But not go too much into technicality also, because if you go too much into technicality, then the patient may not receive also, because one has to understand any exercise is better than no exercise at all. Something is always better than nothing. So you should prescribe an exercise that he or she has to do it. That doing is more important. And exercise should be celebration of what your body can do, not an punishment of what you add. So that is also important. So that thing one has to understand. And regarding the intensity of the exercise, how much intensity you have to prescribe, just 2-3 points you have to remember. If a particular person is able to sing and talk, then that is a mild intensity exercise. If a particular person is able to talk but not able to sing, that is a moderate intensity exercise. If he is not able to talk at all, then that is high intensity exercise. So high, low, moderate intensity exercise you can prescribe. If you want to go into technicality stuff, you can go into the different technically, like by using the heart rate monitor, which are markedly available, you can prescribe the different exercise intensity, which I will not go into the detail. So for the practical point of view, this is, this is a simplified diagram which we prescribe, like for example, percentage of maximum heart rate 57, 64, 77, 96, 96. That is how we remember. If it is less than 57, then it's very light. More than 57, less than 64, it is light. In this way, and for example, for resistance exercise, 30, 50, 70, 85, 85. If it is less than 30% of your maximum weight, which you are able to lift once, then it is the very light exercise. That is known as 1 RM. RM means repetition maximum. 1 means only one time. If you are able to lift that particular weight only one time by maintaining all the form, then that weight is your maximum, 1 RM. So 1 RM can be, a percentage to 1 RM, we can prescribe the resistance exercise. So smart goal has to be followed. It has to be realistic. It has to be specific. If you are prescribing exercise to a marathon runner, then it has to be different from a sprint runner. So that one has to understand. And realistic goal has to be, and time bound and more attainable goal has to be there. Otherwise, the particular person will not be able to follow. So that's why a behavior counseling is also very important in case of the lifestyle clinic or physical activity clinic or exercise clinic, where you have to assess the problem, you have to advise according to the problem, you have to agree what are the changes which has to be done. You have to assist that particular patient or subject, how he can do it. You have to provide everything in writing. Prescription, exercise prescription is very important, and if he or she need, then you have to assess it and you have to arrange that particular thing for him. That is important, because you have to change the thinking from pre-contemplation, that means no intention to change, to action. No intention to change, then you make it to he or she does that particular exercise. And you maintain it and you avoid a relapse to the particular behavior. So pre-contemplation, contemplation, preparation and action, these are the behavior therapy technique which we have to follow in order to provide the sustainable exercise prescription. And in order to go into the specifics, we have to understand the different fitness also. Why this is important? Because each exercise can target each component of the fitness. Like for example, cardiorespiratory fitness, body composition, muscle strength, endurance, flexibility. So each component has to be targeted, whether it is a health related, more into lifestyle medicine, or whether it is a skill related, more into the sports medicine component, performance medicine, where we target the different agility, coordination, balance, power, reaction time and everything which is required for that particular performance enhancement. So this has to be deal into that particular taken into consideration in order to design that particular exercise. So that's why we have to understand. So let's focus on the cardiorespiratory fitness. Cardiorespiratory fitness is very important, not only for the player but also for the general people. Like for example, say if you see the comparison of the diabetic, this is a diabetic, this is a non-diabetic, you can see that the VO2 max is very, very low in case of the diabetic, and that low diabetic, it is still there if you control for the differences in the body composition and body percentage body fat. That means the fitness may be low, cardiorespiratory fitness may be low in diabetic because of the he or she is having more obesity. But if you control that differences, still the cardiorespiratory fitness is low in case of diabetic. That's why the fitness is more important than fat. Fit is more important than fat. The person may be having a little bit of adipose tissue, but he may be more fat. So that is one has to understand. So our aim should be targeted on improving fitness, not on weight. Weight is the minimum. We should focus on the body composition, not on the weight. And this is just another thing where you can see the HbA1c, and this is the VO2 max. You can see that the lower inversely proportional. That is HbA1c will be more in case of the less fitness. So fitness is very important, not only for the maintenance of the glycemic control and everything, and for also the cardiorespiratory fitness in case of the mortality. You can see that the inverse proportional is there, both male and a female. That means for every increase in metabolic equivalent, that is metabolic equivalent is quantification for exercise, you can see that cardiorespiratory fitness increase, then you can 11.6 reduction in all-cause mortality happens. So that's why the fitness is very important. In case of the patient also, that is important. That is cardiac rehabilitation is also like clinical exercise physiologists we have to target. And you can see that as compared to the high cardiorespiratory fitness with the low cardiorespiratory fitness, 58% reduction in mortality can happen. All-cause mortality can be reduced by 68%. So that's why not only for the athlete, not only for the type 2 diabetes, not only for the healthy people, but also for the person who are already suffering from the cardiac problem is very important. Like dementia also, 90% reduction in dementia can happen if you have a very high fitness. So what else you require? So fitness is very important. Why this is important? Because the fitness, cardiorespiratory fitness target three things. One is your respiratory system. Respiratory system, exchange of gases happen. Your cardiovascular system, heart, and your muscle system and mitochondria. Three important things here. That's why fitness is very important. Cardiorespiratory fitness. The more cardiorespiratory fit you are, the more fit will be your three system. That is your cardiovascular system, lungs, and muscular system. That is one has to understand. And you can see that for a sport player is also important. Like for example, if you see the more high fitness, this is the high fitness. And you can see that reduction in injury happens if you have a more fitness. 51 to 5.6, that is maximum aerobic speed. If you have there, then reduction in injury happen. That means for injury prevention also, fitness is important. These are the different papers which we have the published in hockey players and everything. And not only cardiorespiratory fitness, but also muscle fitness. Like for example, 69% of sports injury can be reduced if you have a strength training. That is important. And similarly, injury can be reduced if you have a lower body strength. If the more lower body strength, the less will be your injury risk. That's why fitness is very important. These are again the different papers which we have published in this target. And that's why muscle is also not very important. Not only target your cardiorespiratory system, but also the muscular system. Why this is important? Because after 40 years of age, decline of muscle will happen. That is the sarcopenia will happen. Up to 1%, 1 to 1% of the percentage of the muscle mass can be lost in a year. Or your muscle strength, that is 3% can be lost. That is known as dynapenia can happen. And it can only be prevented by doing an exercise with adequate protein intake. Resistance exercise, adequate protein intake, these are very important if you want to prevent that sarcopenia. Why this is important? Risk of fall. This is the definition of muscle-centric approach which we have used. Muscle-centric approach is a physiological intervention where we use optimum evidence-based exercise with the lifestyle and the nutrition. Nutrition means adequate protein intake. Because see, after the age of 65 years, 33.3% of fall will be there in 1 year. It will increases to 42% after 70 years. 90% of the hip fracture, may happen because of the fall, and 20% is fatal. How you want to prevent it? You have to. You can prevent it by doing exercise. Exercise and nutrition, because reduction is there not only in the muscle mass but also the quality of the muscle. Type 2 muscle fiber decreases. That's why muscle is known as the organ of the high longevity, whereas fat is the organ of inflammation. So you have to reduce the fat, you have to increase the muscle. That is important. And also, similarly for females, menopause, osteoporosis, very important, because decline will happen after the 40 years. 0.5% per year of bone mass will decrease. How you can target it? Bone mass, if you can target during your pre-teen age, that is pre-puberty, if you target that particular child by doing an adequate impounding activity, jumping activity which challenged your bone system with adequate nutrition, then you can have you can counter this decline. So that's important. Because obviously we always focus on fat. We always forget the muscle. Muscle is also very important. Muscle-centric medicine is very important. Target the fat also, but don't forget the muscle. Because for longevity, three things is very important. Your thigh muscle mass, your hand grip strength. Muscle mass is very important. Not only your heart and lungs, but also muscle mass is important. That's why metabolic flexibility, for metabolic flexibility and overall health, muscle should be targeted. And muscle is important not only for your general health, but also your cognitive ability also. There is bi-directional relationship between your muscle mass and your cognitive health. So it can easily be measured by using, say walking space, grip strength, the appendicular lean mass. We can easily do in our lab. So that's why very important. And for metabolic health also it is important. If you see the insulin-mediated glucose uptake, even for an elderly, that is black is the elderly population, if you are an athlete, your insulin sensitivity much higher as compared to the obese. That means for metabolic health also muscle is very important. And hand grip is very important for cardiovascular mortality. Even it is said to be more important than your blood pressure. Simple hand grip strength, if you can do easily in your clinic, it is very much important. And why this is important? Because in India, we are facing this central visceral obesity. I have already focused. Yes, central obesity hota hai. A South Asian Indian phenotype, where and the proportion of the pre-diabetic and diabetic may be because of this reason where the fat is deposited in the viscera, that is known as TOFI, toffee, fat inside, thin outside, fat inside, TO, thin outside, fat. You look thin from outside, but all your fat is deposited inside. That is more dangerous. This is why we are facing, because this is if your fat is more inside your organ, then you are more metabolically problem. And this visceral fat, that is known as visceral fat, central obesity. Visceral fat cannot be targeted by your diet. You cannot just do dieting and just remove the fat. Dieting may be required for other problem, not for visceral fat. For visceral fat, you have to add exercise. If you do exercise and nutrition, then your increased rate of the visceral fat, VAT, visceral fat adiposity is there as compared to the diet. So that one has to understand. And for visceral fat, which type of exercise is very important? High intensity interval training, sprint interval training, aerobic and resistance training, very important. For moderate to vigorous intensity, these are important. Like for example, 3 times a week for 3 to 4 months of say 30 to 60 minutes of exercise can be helpful if you want to target your visceral fat. Why visceral fat is important? Because visceral fat is the one which is causing the problem. They are highly inflammatory, chronic inflammation, it can rise. Just taking an example of your fatty liver. You know that 10 years before you develop type 2 diabetic, your fatty liver has started. That it is known as the scream or silent cry of the liver. Your liver cry 10 years before you develop the type 2 diabetes. This is very, very important. This is known as a long silent scream from the liver. And if you see the fat content is very, very high, then your whole body insulin sensitivity is very low. That's why this visceral fat, removal of visceral fat is very important. And for reduction of this visceral fat, exercise is very important. I have already spoken, not only this nutrition, but exercise is very important. Simply by doing say 150 to 240 minutes per week of at least moderate to high intensity exercise can remove 2 to 4% of absolute fat reduction from the liver. So that one has to understand. And in addition to the aerobic exercise, you can add rest and exercise also. So going into the diabetes, if you see lifestyle intervention with metformin, metformin is the most commonly drugs we use in diabetes. It is comparable in case of the elderly population. That means metformin, diabetes is more effective. And if you see the metformin reduction, 31% can be reduced by metformin. But lifestyle intervention, type 2 diabetes risk can be reduced by say 58%. So by just adopting a 150 to 175 minutes of physical activity, you can reduce the type 2 diabetes up to say 70%. And for every kg weight loss, 16% type 2 diabetes reduction can be done. And also mortality is also reduced. Both for type 2 and type 1 diabetes, mortality reduction is there. So when you see the comparison between the exercise and metformin, exercise has lots of beneficial effects which metformin may not have. And if you combine metformin with exercise, then many of the chronic adaptation of exercise may be lost. This one has, like for example, simply say VO2 max. Aerobic fitness increases by exercise, but metformin doesn't do that. So there are lots of things which exercise can do, but the metformin doesn't do this one. One has to understand. And for type 2 diabetic, we have to monitor the glucose by using an ideal CGM, that is continuous glucose monitor. This Eliab Kipchoge, we in sports science also, sports medicine also, we use CGM for monitoring the thing. Why this is important? Because 120 gram per hour of glucose can be utilized in case of the chronic exercise, which may lead to hypoglycemia if you are taking say exogenous insulin in type 1 diabetes. This one has to understand. But if you are doing high intensity exercise, the liver can pull up 10 times your glucose. That means hyperglycemia and ketosis can go in type 1 diabetes. So that's why you have to understand. For aerobic exercise, blood glucose can decrease, but for high intensity and anaerobic exercise, blood glucose may rise. So you have to take all this into consideration before prescribing exercise to type 2 diabetes. Like for example, a single aerobic exercise up to 72 hours, insulin sensitivity is maintained. That is LOPE, that is late onset onset hypoglycemia can last up to 24 hours. That one has to understand. If you are doing, say, late night exercise, then you may have, say, late night hypoglycemia, especially in type 1 diabetes. So you may have to take certain glucose also. And what is the rule of thumb? We generally use the rule of thumb is 15 to 20 gram of glucose every 1 hour. We generally prescribe in case of the type 1 diabetes if you want to do exercise. And if the blood sugar is more than 250 plus ketone, do not do exercise. If the blood sugar is 300, stop, don't do exercise. What is the ideal blood sugar before the exercise? It is 180. 120 to 180 milligram per deciliter. That is the practical tips which we use in case of the prescribing exercise to diabetes. There are lots of different things which I don't want to take into consideration. But the main point which I want to say that, for example, if you want to prescribe aerobic exercise by using the FIT principle, frequency how much? 3 to 7 days per week. Intensity how much? 40 to 59% of your VO2R. That is, VO2R is the VO2 reserve. Or say for type 1 diabetes, 150 minutes per week. Type 2 diabetes, 150 per minute of moderate to high intensity. This thing can be used. Resistance exercise you can do, like for example, 3 to 4 times a day. So this thing one has to understand. So not only for diabetes, not only for type 1, type 2 diabetes, hypertension also, exercise is a medicine for hypertension. But before prescribing exercise for hypertension, you have to do certain things which one has to understand. For example, if your resting blood pressure is more than 200, don't do exercise, khatam. If it is diastolic is more than 120, do not prescribe exercise. If your exercise hypertension during the exercise is more than 200 by 115, don't do it. If the rise in your diastolic blood pressure is more than 15 millimeter mercury, stop the exercise. So there are lots of integrate which one has to understand. Like for example, Valsalva maneuver, like breath holding should not be done if you are doing a resistant exercise in case of the hypertension. Otherwise, what will happen? Your retinal problem may happen. So these are the tips which one has to use before exercise is prescribed for hypertension also. But it is very effective. If you see, compare the exercise with the drugs also, which are different drugs are used for hypertension, you can see that the exercise can decrease the systolic and diastolic pressure up to 8.78 millimeter of mercury, 8.96 millimeter of mercury. Exercise can, sometimes the reduction by exercise is more effective as compared to the certain drugs also. But naturally, one comes, which type of exercise? कौन सा exercise देना चाहिए? Which type of exercise is more important? Recent has said the isometric exercise, simple by doing a isometric hand grip exercise, you can reduce your blood pressure up to 8.2 millimeter mercury for systolic and 4 millimeter mercury for diastolic. It is resistant exercise is more effective as compared to your aerobic exercise. We generally prescribe walking, but we forget the resistant exercise. In case of the hypertension, resistant exercise is very important, especially the isometric resistant exercise. So these are the integrate which one has to understand. And regarding the obesity and overweight also, we exercise can be an effective medicine in order to maintain that particular weight loss which is achieved by doing a hypocaloric diet. Like for example, weight loss can be say 0.5 to 1 kg per week of weight loss is allowed scientifically. If you are losing more than that, then you are not losing fat, you are losing water. Water. So these are the different things which one has to understand. Our aim should be 10% weight loss in 3 to 6 months, not more than that. Otherwise, you are losing lean muscle mass. So if you are doing hypocaloric diet, you are losing weight, but that weight is muscle mass. That is not healthy. If you are doing hypocaloric diet plus adequate protein, you can reduce that lean muscle mass loss. If you are doing hypocaloric diet plus adequate protein plus aerobic exercise, you may limit the loss of your muscle mass. But if you are doing resistance exercise along with that, hypocaloric diet plus that adequate protein, you are maintaining your lean muscle mass. You are increasing your lean muscle mass. So that is the funda which one has to understand. So my I am summing all the point which I have spoken into a more integrated approach. Dr. Gagan will be speaking the diet control. So chrono medicine, chrono exercise, maintaining, aligning with your circadian rhythm is also important. Like for example, you should not eat breakfast. Breakfast, you can eat breakfast, but it should be at least 1 to 2 hours after. Because melatonin is high, melatonin has a direct effect on insulin, interfere with the insulin. Insulin resistance can develop. So at least wait for 1 to 2 hours before having breakfast, just after wake up. Then in the daytime, at least 30 minutes of activity during the daylight. Sunlight is very important, not only for vitamin D, but also for other things. Sunlight is very important. And you can maintain that time restricted eating, say 8 hours, 10 hours, 11 hours, depending upon your require. You do not keep on eating always. Your body, your physiologically, evolutionary, we are not designed to eat every time. There should be some gap. That is very important. And before the bedtime, don't eat 2 to 3 hours before the bedtime. You give some rest to your GIT. Otherwise, how can you sleep? So some rest has to be given, and at least 6 to 7 hours, at least 7 hours. For athlete, we say 9 hours of bed rest should be done. For that, you have to go in the bed for 8 hours. 8 hours. If you remain in the bed for 8 hours, then say 7 hours you can sleep. So this is the concept which we have to follow in a holistic manner. So thank you very much. So what the point which I want to say is physical activity, exercise, and positive lifestyle. Very important. Why this is important? It will cause us positive physiological adaptation. And this positive physiological adaptation is important for 2 things. The first one is human performance optimization, number 1. Number 2, sports performance optimization. So sports as well as fitness for overall health, the physiological adaptation is important, and for the physiological intervention in the form of exercise, in the form of sleep, in the form of nutrition is very important. Just see this lady, she is the oldest competitive female bodybuilder, 74 years old. So how she is maintaining her lifestyle. Thank you very much.
Thank you, Dr. Hanjumam Varun Sharma, for excellent talk on the exercise to prevent and treat effectively the modern diseases like diabetes, hypertension, and mental disorders. Yeah, definitely as an orthopedic surgeon, I also recommend exercise to improve the bone strength. Not only the bone strength, the muscle strength. If the muscles and bones are weak, there is a high chance of getting fractures. So definitely we should follow that. To prevent the modern lifestyle diseases, exercise is must. But I see most of the time here, most of the PGs, they use the motorbike to reach the hospital. Hardly 2 minutes walk. That also they don't do. And how can you maintain their health? I have seen that many are so obese, but they go on motorbike. So they can't maintain the good health. Thank you.
Thank you, sir. Now I would request the audience to have any questions on this session. Online, do you have any questions? Anyone? Okay, please.
Sir, what is the exercise regime one should follow if they follow any regime of fasting? Fasting.
See, fasting exercise regimen, two, three things you have to understand. Number 1, fasting should not be into starvation. The moment your muscle mass loss, that becomes starvation, not fasting. Number 1. Number 2, for what type of exercise you want to do in fasting, you can do depending upon your fitness level. You can do aerobic exercise. You always start with aerobic exercise. Aerobic exercise is the main core fitness body. Then you can do strength training also depending upon your requirement. But depends upon your fitness level. So fitness level during the fasting, like for example, some literature are there which says that if you do fasting, cycling, or say aerobic exercise, by skipping the breakfast, then there will be more burning of fat. But if you see the overall picture of the fat reduction, that may be comparable whether you take, breakfast or not. That is also there. So some literature is also supportive, some literature are not supportive. But the point is, your fasting, what type of exercise you have to do, it depends upon your fitness level. Okay. Thank you. Sure. The Kunal sir को मैं अच्छा YouTube में वाले okay.
Early morning doing exercise.
Yes. See, fasting, definition of fasting varies different. Like for example, time restricted eating. People are following intermittent fasting. They can do, say, the 16-hour of fasting, 18-hour fasting, 2 days fasting, OMAD, 1 day fasting is also there. So depending upon a type of the fasting, it is also there. But the point is, you should not go beyond, what is not required of your body. That you have to understand your fitness. The best judge is you yourself. You have to understand.
You said that for diabetes, one type of exercise is preferable, and for hypertension, the other type. Most of the time, we see the person who is having diabetes also having hypertension. So, what is your recommendation about that?
Absolutely. Literature says that the one type of exercise is not preferable on another. It is combination of exercise. Like for example, the last slide which I have shown is regarding the hypertension. When they compare with different type of exercise, they found isometric exercise to be more better. That is for hypertension. For diabetes, always combination exercise is very important. Aerobic exercise is important for insulin sensitivity. It increases the AMPK kinase. That means GLUT4. That means, non-insulin dependent GLUT4 translocation is increased by your exercise, aerobic exercise. Resistance exercise is important because it builds up the muscle mass. 80% of your glucose after your postprandial glucose, kahan jata hai? Muscle. If you don't have the muscle, then where will it go? So muscle mass is also important. Muscle mass can only come by resistance exercise. Aerobic exercise doesn't fill the muscle mass. It builds only your cardiovascular health. Resistance exercise has to be there. A combination of exercise is preferable for type 2 diabetic patient. For hypertension, also combination of exercise. So combination of exercise, concurrent training, it is preferable and should be done.
Thank you, sir.
I would now request Chairperson Sir Dr. Papa Naik to felicitate the speaker by giving mementos and certificate. Khushi, please come. Clap. Sir, please, one second, sir. I would like to now call upon on the stage Professor and HOD Physiology, Professor Dr. Maloy Bikash Mondal, sir, to come on the stage and to give a token of gratitude to the chairperson, sir. Thank you, sir.
Now I would like to invite our distinguished dignitaries to take their seats on the stage. Our Honorable Vice Chancellor, Sir, Professor Dr. Sudipto Bose, Honorable Registrar, Sir, Dr. Ichchit Bharat, respected Vice Principal, Sir, Professor Dr. Ashitaba Debroy, respected Medical Superintendent, Sir, Professor Dr. Papa Naik, the respected Organizing Chairman and HOD Department of Physiology, Professor Dr. Maloy Bikash Mondal, Respected Organizing Secretary of the CME, Professor Dr. Kunal. সবাই চলে এসছে। না স্যার, আসবে না। তারপরে বলছি না। ল্যাম্পের বলে দেবো। বলবো না।
पालनहारे निर्गुण न्यारे तुमरे बिन हमरा कौनो नहीं, तुमरे बिन हमरा कौनो नहीं। शुभं करोत्वं कल्याणं आरोग्यं धनसम्पदा, शुभं करोत्वं कल्याणं आरोग्यं धनसम्पदा। शत्रुबुद्धि विनाशाय दीपा ज्योति नमोस्तुते, शत्रुबुद्धि विनाशाय दीपा ज्योति नमस्तुते, दीपा ज्योति नमस्तुते। शुभं करोत्वं कल्याणं आरोग्यं धनसम्पदा, शुभं करोत्वं कल्याणं आरोग्यं धनसम्पदा, आरोग्यं धनसम्पदा, आरोग्यं धनसम्पदा।
Call upon Dr. Professor Malay Bikash Mandal sir on the dais to deliver the welcome speech. Sir.
Thank you, Dr. Raut. Good morning. Honorable Director, Sir, in absentia, esteemed dignitaries on the dais, respected Vice Chancellor, Mata Gujari University, Dr. Sudipta Bosu, Sir, respected Registrar, Mata Gujari University, Dr. Ichit Varad, Sir, in absentia, able and very dynamic Vice Chancellor, Vice Principal, and today's officiating Principal, Mata Gujari Memorial Medical College, Dr. Ashita Horai, our beloved Medical Superintendent, Dr. Pappa Naik. On behalf of the Department of Physiology and Organizing Committee, I welcome you all in this CME program on the topic Application of Physiological Techniques in Prevention of Lifestyle Diseases. I especially welcome our outstation resource faculties, Dr. Varun from BHU and Dr. Gagan from AIIMS Patna, who have come all the way from Varanasi and Patna in response to your request in short notice. I also welcome other distinguished members in the audience, Professor Shoibal Banerjee, Professor of Surgery, Professor Ashima Bhattacharya, HOD, and the in-station, outstation delegates who are registered online or offline, Principal, Nursing College and Pharmacy, Dean Pharmacy, HODs of other departments, my fellow faculties, my dear residents and students, and our efficient office personnel, ladies and gentlemen. It provides me an immense pleasure and a proud privilege to welcome you in today's CME on application of physiological techniques in prevention of lifestyle diseases. We are now aware that lifestyle diseases are increasingly grabbing more and more population all over the world, including India. Lifestyle diseases have become a major global health issue. Now no one can deny its serious impact on the economy due to alarming increase in the number of people suffering from lifestyle diseases. However, there are a number of non-pharmacological and non-surgical techniques which we have referred here as a physiological techniques can help us to relieve from these various lifestyle diseases. In fact, lifestyle medicine has emerged as a separate, independent, and new discipline branch of medicine. Therefore, we thought that it is the need of the hour to organize a CME and help increase the awareness among healthcare providers and in turn to improve the quality of health in larger population. So this CME was conceptualized only 1 month back, and we have been able to do it by the support of all. In this CME, we have 5 sessions. The first 4 sessions are aimed to explain the roles of exercise, then diet, and yoga. So the exercise lecture we have just finished. And in the last session, I will present the physiological basis of lifestyle medicine, covering importance of sleep, social connections, and avoidance of risky substances. I sincerely hope that CME will be very useful and successful, especially by the deliberations from the outstation faculties from BHU and Patna, AIIMS, who are well-known experts in their respective fields, and also valuable participation of the other delegates and chairpersons and the audience. I wish the outstation faculties and delegates a pleasant stay and enjoy this beautiful campus of the university. Once again, I welcome you all to this one-day CME. Thank you very much.
sir, for sharing your valuable thoughts with us. Now it's time to welcome our esteemed dignitaries with bouquets. Khushi Arya. Manpalak Jot Kaur. এখানে মাইকে মনপলক জোত কর Parastip Kaur to our medical superintendent sir. Medical superintendent sir. Nancy Kumari. ল্যাম্পটা সরিয়ে দিতে বললাম to our organizing chairman Professor Dr. Malay Bikash Mandal sir. Himani Singh. Last. Thank you. Now I would like to call upon our respected Vice Chancellor, Sir, Professor Dr. Sudipta Bose, to share his valuable thoughts with us. Sir, over to you.
Thank you, Madam. Honorable Director, MGM Medical College and LSK Hospital in absentia, respected Registrar, Dr. Ichit Bharat Jaiswal, Mata Gujri University in absentia, respected Principal, MGM Medical College and LSK Hospital in absentia, respected Vice Principal, Head of Department of Physiology, Medical Superintendent, Organizing Secretary, faculty members across all the units of the university, the Principal College of Nursing, Principal College of Pharmacy, all faculty members, delegates, outstation resource persons, as has been already pointed out by that of the department, who have taken time off from their busy schedule to be here. My dear students, all categories of staff, ladies and gentlemen, it is indeed a proud privilege and an honor for me to welcome you all, one and all, and particularly the outstation resource persons who have taken time off to be here. It is an excellent occasion, and as you would appreciate, I heard what the head of the Department of Physiology said. I think the topics have been well sort of distributed, particularly three aspects. One has to be very pragmatic about the topic, the contents, depending upon the time schedule. I take it it is a one-day program, and therefore this diet, exercise, and then the physiological changes which will affect have been highlighted. To me, I think the topic has been well thought about. Today, it needs no emphasis that there are a number of diseases for which lifestyle modification, diet and exercise go to play a large role. Today diseases have come in which were non-existent, and that has been because of faulty methodology, whatever be, the socio-economic, the financial things, whatever be. So therefore, steps must be taken to correct and rectify it. And it starts with the physiological basis. So you understand physiology, if you think back, even to my seniors, I would say, therefore in anatomy, physiology is the basis. And then we go on to the pathology, community medicine, all these communicable diseases, lifestyle diseases. So for that to understand, one has to have a physiological basis, and then we get across it. I wish this CME a grand success, and to all the participants also, that they would be greatly benefited. I would be failing in my duties if I think, and I think the organizing secretary and the HOD will also agree with me, that the authorities here leave no stone unturned to make it a grand success. I wish you all the best. Thank you.
Thank you, sir, for sharing your valuable thoughts and for your continuous support to the students. Now I would like to call upon our respected Vice Principal, Sir, Professor Dr. Ashithabo Deb Roy, sir, to share his valuable thoughts.
Good morning, everyone. Honorable Vice Chancellor, sir, respected MS, sir, organizing chairperson, Malay sir, organizing secretary, Dr. Kunal, esteemed guest speakers from BHU and IMS Patna, respected faculty members of our institute, principal nursing, principal pharmacy, respected faculty members from other allied institutes, and my dear students. The topic of this CME today is very pertinent. You see, the topic is application of physiological techniques in prevention of lifestyle diseases. Now, these terms, first term is prevention. And as we all know that we have heard about this phrase called prevention is better than cure, isn't it? Most of us here are physicians or would-be physicians. So we would be expected to cure diseases, right? But then these are some diseases where we call these quote-unquote lifestyle diseases, where probably these diseases do not have a cure as such. We can control these diseases, but cannot probably cure these diseases. So it's always better to prevent these diseases. How do we prevent these diseases? Probably by these physiological techniques. Sharma sir in his lecture just now was saying that if you start preventing these diseases, start doing these exercises and all, we'll stop going to the pathologist. I myself am a pathologist, and I would be very happy if patients don't come to me. Because you see, one of the very, one of those dangerous lifestyle diseases which is very, majorly cropping up these days is cancer. And it is said that only 5 to 10% of the cancers are inherited, rest 90 to 95% cancers are acquired. So, which you actually can prevent. And in our department, unfortunately these days we sign out, almost 15 to 20 cancer cases every week. So high the incident it has been. So if it is like, if it does not come to us, we would really be happy. And there are measures how you can change your way of living, change your diet, change your lifestyle, start doing exercises, and that is how you can change or modify your lifestyle as well as modify your, prevent these lifestyle diseases. I was also very happy when sir said that it's not important about, it is more important how fit you are than about how fat you are, because you should be fit Um, I mean, how fat doesn't matter, but you should be fit, because there are there are areas where it's very difficult to get rid of fat. So it's important that you be fit mentally, physically, and in a wholesome manner. You have to be fit. So I once again wish this CME a grand success. The opening was so good, so I hope the whole day would run very good. Thank you so much. Thank you.
Thank you, sir, for sharing your valuable thoughts and for your continuous support to the students. Now, I would like to call upon our respected organizing secretary, sir, Professor Dr. Kunal, to deliver his vote of thanks.
Good morning, everybody. University, my beloved students, and respected delegates, both online and offline. On this occasion, one very contemporary slok is coming to my mind. I would like to quote it from Valmiki Ramayana. Natu aham kamaye rajyam, na swargam na punarbhavam. Kamaye dukh taptanam, praninam artinashanam. It's very relevant for doctors. It means ना तो मुझे राज्य की कामना है, ना ही मुझे मोक्ष चाहिए, ना ही स्वर्ग चाहिए. मुझे तो दुख में जलते हुए प्राणियों की पीड़ा दूर करने की शक्ति चाहिए. प्राणिनाम अर्तिनाशनम. I offer my prayers to the God Almighty that the CME should be useful in alleviating the pain and suffering of one and all. The way everything fell into the place, we thank God for channeling all the cosmic forces in the favor of ever committed team of Mata Gujari University. We are grateful to the Honorable Director Dilip Kumar Jaiswal in his absentia for always being a pillar of great support. Thank you. We take this opportunity to express our heartfelt gratitude to the Vice Chancellor, who possesses an exceptional oratory skills, Dr. Sudipta Basu sir, for his ever encouraging words and constant support. I bow my head in respect to our well-regarded registrar, Dr. Ichit Bharat, in absentia, of course, for ever ready to listen to our requirements and fulfill them immediately. He has surely been the constant pillar of our strength. Sir, please accept our deepest gratitude. Without your commitment to the quality and advancement of medical education, none of this would have been possible. We offer our sincere thanks to the remarkably knowledgeable Vice Principal and Acting Principal, Professor Dr. Asitava Deb Roy. I always consulted him from the very beginning, from the making of the brochure to the planning of the inauguration ceremony. His reply almost always came immediately and was very apt for the situation. I seriously owe you one that can't be repaid. May I take this opportunity to salute the promptness and commitment of our esteemed resource faculty, Dr. Barun from BHU and Dr. Gagan from AIMS Patna, who managed to be a part of our CME on such short notice. This has been such a blessing to have you both here. I'm sure we will be immensely benefited by your expertise. Thank you, sir. We are happy to mention our obligation to the Medical Superintendent, Professor Dr. Papa Nayak, sir, from the Department of Orthopedics, for his support and agreeing to be the chairperson for the pre-inaugural session. Sir, it couldn't have been done without you. Thank you very much. I respectfully appreciate the support offered by Professor Dr. Saibal Mukherjee, sir, from the Department of Surgery, Professor and Head of the Department of Anatomy, Dr. Asima Bhattacharya, ma'am, Professor Dr. Prithvish Bhattacharya, sir, from the Department of Anesthesia, and Professor and Head of the Department of Community Medicine, Dr. K. Bhattacharya, sir, for accepting the role of chairpersons. Thanks for having our back. Thank you. I have to give credit where it's due, especially to our OSD, Rita D, graphics designer Anand, all the staffs of administrative block, all the faculty and staff of the Department of Physiology, led by one of the extremely experienced and a father-like figure to all of us, Professor Dr. Malay B. Mandal, sir. Only because of his persuasion, organizing this event became possible. Special thanks to our PGT, Dr. Muhammad Fazal Sultan, and all the staff of Engineering and General Store Department for working tirelessly with us during last 2-3 days. We offer our sincere thanks to the Master of Ceremony, Dr. Arup Mandal and Dr. Payal Sarkar, all the delegates for trusting in us and registering for the CME in great number. As you may be aware, we are approaching nearly 700 registration. That's one of the milestones for a CME program. So thank you very much. Without your all support, none of this would have been possible. Last but not least, allow me to mention our heartfelt appreciation to the media person and blessings to all the students, volunteers especially. May God bless you all with a very bright future ahead. Finally, I conclude my statement with a few words of Kavi Dushyant, very apt for everyone who are lifelong learners. कौन कहता है कि आसमां में सुराख हो नहीं सकता? सुना है? कौन कहता है कि आसमां में सुराख हो नहीं सकता? आगे? एक पत्थर तो तबीयत से उछाल कर देखो. Thank you. Thank you very much.
Thank you, sir, for sharing your valuable thoughts. Now it's time for our national anthem. So I would request everyone to please stand up for the national anthem.
Okay, we start our national anthem. Janagana Manaya Dhinayak Jaya He Bharat Bhagya Vidhata Punjab Sindh Gujarat Maratha Dravida Utkal Banga Vindhya Himachal Yamuna Ganga Uchchal Jaladhi Taranga तब शुभ नामे जागे तब शुभ आशीष मागे गाहे तब जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे Indian Society of Chronomedicine, and the International Medical Science Academy. In addition to delivering lectures and conducting workshops at esteemed conferences like ISS EMCon and SOPCon, I will ask our first year student, Sayantani Malik, to escort our honorable speaker, sir, on the stage. Sir, please have a seat. To chair this session, I would like to call upon the stage Professor Dr. Shaibal Mukherjee, sir, from the Department of General Surgery, Mata Gujri Memorial Medical College, Kishanganj. I will ask Amrita Gupta, first year first prof student, to escort sir on the stage. I will now request Dr. Gagan Kumar Banode, sir, to deliver his speech. Sir, please come.
Thank you very much, Dr. Arup, for the introduction. First of all, I would like to thank Dr. Mandal sir, Dr. Kunal sir, Dr. Arup, and the dignitaries present of of Mahakujri University, and all the professors and delegates and students. I wanted to thank you all for present over here. I am Dr. Gagan Kumar Banode. I am from Chhattisgarh, Raipur, Chhattisgarh, and I did my MBBS from Raipur, Chhattisgarh. And if you see, Dr. Varun is my MBBS batchmate. And we are together since 21 years. Okay. So, what you get out of it? It's a part of lifestyle medicine, social connection. Loneliness is the problem. Okay, don't be alone. Be with someone. Okay, make friends and enjoy your life. That is our agenda in lifestyle medicine, one of the part. So Mandal sir will talk about lifestyle medicine. So you see, I have done MBBS from Raipur, Chhattisgarh. After that, Dr. Varun introduced me to the sports medicine. He was the Thang Ta player and Taekwondo player, and I was the tennis player. So he introduced me sports medicine and sports physiology. So we did that from NIS Patiala. And when we were, yesterday evening, we were roaming around in your campus, everybody was playing and reminded us of Patiala. You know, in Punjab, Patiala, we were there. I was there for 4 years. And all the athletes were there and we served them as a sports physician. After that, I did MD Physiology from AIMS Delhi. Then I served as a senior resident in various AIMS. AIMS Gorakhpur, AIMS Raipur. Then recently joined AIMS Patna since 1.5 years as a faculty. So basically, through our association also, we are promoting healthy lifestyle. Okay, like we made, Dr. Varun was the president, we made a society which is called as Indian Society of Sports and Exercise Medicine. Okay, we are the sports physicians, so we made a society for ourselves. And promoting health, we have introduced lifestyle medicine through our association in a recently concluded conference in BHU Banaras in November. And also we are bringing exercise medicine in India, which is an initiation of American College of Sports Medicine. So through all this, what we are trying to do? We are trying to prevent the disease, because treatment part is already done, but the prevention is still not done. And we are the person, as a physiologist, we can do that. Okay, so my talk is one part of that, that is the dietary intervention. So let's start with that. You see, if you can recognize, he is a bodybuilder. Everybody knows his name. Can you tell me his name? Very good. So, what you eat, you become. Okay, what you eat, you become. So, apart from exercise, diet is a very important part of your lifestyle. Okay. Uh, as you see, I am a tennis player and I follow tennis players a lot. I'm a fan of Roger Federer. Apart from him, another player who has became his name, who has made his name because of dietary changes. His name is Novak Djokovic. When he came into limelight, he was not that big player. He had some issues, but he went into the gluten-free diet, and whatever he has become because of the one of the factor, most important factor is the dietary change. He has done his training. Okay. So if you see, lifestyle diseases or non-communicable diseases are most prevalent now. More than 40 million deaths per year are occurring due to lifestyle diseases every year. It is a WHO's data, and more than 80% are occurring because of the cardiovascular diseases. More than 80% are deaths are because of cardiovascular disease. And what is the origin? Origin is unhealthy lifestyle, physical inactivity, and bad dietary habits. Okay, whatever you are taking, you are becoming. Understand? So, and if you see, what is the important, very, very important part? It is a modifiable risk factor, dietary habits. So, unhealthy habit, physical inactivity, addictions, whatever the major contributing risk factors for the CVDs and NCDs are modifiable. So, as per global burden of disease studies, these risk factors are kept in 10 most risk factors. See, leading risk factors in 1990s and 2019. You see, tobacco consumption, fourth number was the dietary risk, now came to third. Then, body mass index. What you can do? What I do at AIMS Patna is, when I introduce myself in the first lecture itself, I ask everybody, all MBBS students, tell me your height and weight and calculate your BMI and tell me. How much is your BMI? Just calculate now. I tell everybody, every student, I'm teaching, this is my fourth batch, I'm teaching them. I ask them, what is your BMI? And if everybody has a BMI more than 23, I ask them, do something about it. Because along the line, down the line, you can develop some of the NCDs because of your dietary habits and physical inactivity, because you have high BMI. But you see, this is not the end of the road. Even if you have the high BMI, you can be unfit. Just like Dr. Varun has said, maybe you can have high fat percentage, but still you will be fit. Similarly, even if you have BMI less than 23, you can be fat. How will you know that? You have to do that body composition analysis. Okay. So better than the BMI is the body composition analysis, what we do at our physiology lab in Patna. So, but you can start with BMI. Just see your weight, see your height, go to your BMI, see. If it is more than 23, I am sure more than 50% of you have higher BMI than 23. Okay. So reduce that and start from today itself. So Mandal sir will talk about lifestyle medicine. I'm just telling us in a slide. These are the pillars, 6 pillars of lifestyle medicine that we follow. What are those? First, Dr. Vanur has already talked about exercise. Diet, I'll be talking about the diet. Stress management, just like yoga. Kunal sir will talk about the yoga, stress management. Sleep physiology is very important. Addiction, you have to avoid risky behaviors. And social support, loneliness, depression, you should not be alone, you should be with someone. Okay, make friends, enjoy your life. You are here for only 70 years or more than that, not less than that. It should not be. So enjoy. So major risk factor is obesity. Obesity. These are the patients which are the primary aim of lifestyle medicine. Obese people. Young obese people who are not yet have developed diabetes or hypertension. These are our aim. These are our target population, obese people. in the lifestyle medicine. Okay, you see, it has become global pandemic, as Dr. Varun has already told, and it puts the person to a life on the greater risk of lifestyle diseases. And what are the main reasons? See, high intake of, what are the diets contain? High intakes of salt, saturated fat, sugar, ultra processed food. Currently in America, more than 80% of people are taking processed food only. Even if you see your dietary habits, more than of the 50% are processed food and high fat diet you are taking. I'm telling you, you just calculate your diet for the whole day and you will get to know it. Okay, and what you are not taking? Fruits, vegetable, fiber, you are not taking it. But as per the recommendation, at every meal, your diet should include more than 50% of the fiber, vegetable and fruits. It should be more than 50%, but you are not taking it. So, what does high salt diet do? You see, high salt diet is the risk factor, major risk factor for cardiovascular diseases, hypertension, and even cancers. Salt is a immunomodulator. What it does do? It is a recognized as an immunomodulator that is capable of eliciting a substantial inflammatory response. Obesity itself is an inflammation. Salt intake lead to the inflammation. What does this do? It accumulates in the interstitium, called as the extracellular hypersalinity, and modulate immune cell differentiation, activation and function. So it is basically increasing the inflammation and leading to various diseases. What is the pathophysiology? You see, high salt diet, if you read the renal physiology, normal renal physiology, it will lead to the water retention. Water retention, more water retention, more systemic resistance development, alteration in the endothelial functions, changes in the elastic arteries, finally leading to the hypertension and CVDs. You see, high sodium intake directly lead to the increase generation of the free radical. It is producing the oxidative stress. It is directly affecting your vessels, endothelial function, decreasing the nitric oxide production. Decreasing, this is a vasodilator. Decrease production, what will happen? Increase the systemic vascular resistance. Then, activation of different types of metalloproteinases and decrease in the elastin to cartilage ratio. So, arteries have become less elastic. What will happen? Arterial stiffness and increase in the blood pressure, hypertension, cardiovascular diseases. It can lead to cancer. The findings are contradictory, but it is there. It has been seen in some of the studies that high salt diet lead to increased incidences of gastric carcinoma by altering the gut microbiome. It has been seen that because of it increases the number of H. pylori, promoted its production. That's why it leads to the gastric carcinogenesis. So it is promoting cancer. High fat diet. You already know, if you are taking high fat diet, previously it was promoted for the weight loss, but at the same time it deranged your lipid profile. It lead to the increased triglyceride and LDL levels also. So it is not recommended, not that much. So you see, high fat diet lead to obesity, white adipose tissue dysfunction, glucose intolerance, causing oxidative stress. So generally, the normal nitrate which you are taking for your leafy vegetables, you are not taking. So again, nitric oxide production is decreased and lead to the arterial dysfunction and the CVD. Cancer, carcinogenesis. High fat diet also lead to the carcinogenesis. You see, it is, you are not taking carbohydrate, so number of short chain fatty acid production or number of those bacteria which produces the short chain fatty acids had reduced. That lead to different biochemicals produced which should be produced normally, which limit the carcine or cancer producing cells is not happening. What does it lead to? It leads to the increased production of the pro-inflammatory markers. Pro-inflammatory macrophages lead to the colorectal carcinoma progression. And also because of some of the bacteria which are pro-inflammatory leading to the chemotherapy resistance. So even the chemotherapy is now not working on the cancer patients because of the alteration in the gut microbiome, because of taking the high-fat diet, because of the bad dietary habits. So before going into the dietary intervention, I should tell you about the healthy diet. Okay, what do you understand by the healthy diet or dietary recommendation of a healthy person? Okay, so primarily you should focus on a specific type of food which are unprocessed. You should stop taking packaged food now. You should stop taking packaged food now. Please don't take. If you take, please just read what is written on that. How much sugar is added, how much palm oil is there, how much salt is added. You should read and avoid. In the 50 gram or 100 gram of that packet, they are giving you 400 calories. Okay, burn that 400 calories. You have to do 1 hour of treadmill exercise at 130 of heart rate. I'm telling you. If you do treadmill exercise now for 1 hour, you will burn 400 calories. That you are taking in 5 minutes. If you take 10 rupees of chips, you just see the packet. You should take fruits and vegetables. Plant-based. You see, animal meat lead to the CVDs. So, vegan diet is promoted because of that. So, change your protein intake to the plant-based diet now. Like legumes, take whole grain and nuts. Added sugar, just like you took the tea. Normal recommendation is you should not take more than 9 spoons of sugar for a day for a male, 6 for the females, and generally you take around 25 per day added sugar, 25 spoons per day. Okay, that is not recommended at all. You should reduce your sugar intake to the less than 10% of your diet. Okay, you should include more than 50% of the diet to the vegetables, excluding potatoes. Please don't take potato, okay? Potato is the king vegetable. You should add potato in everything. In Indian scenario, if you see, you will put potato in everything. Please don't do that. Stop doing that now. Potato is recommended for only weekly diet. Only once a week you can take. Otherwise, don't take. Okay? Carbohydrate sources, it should not be simple, but the complex carbohydrate, like beans, legume, whole grain, fruit, vegetables. And if you are taking fats, take monounsaturated and polyunsaturated fatty acids, like omega-3 fatty acids and all. Okay. So this is the recommended healthy activity pyramid. Okay, this is recommended. So you can see in the pyramids, what should you daily do? What is recommended for optimum dose and what is recommended for the weekly. See, daily, what should you do? You should do daily exercise. 30 minutes per day, 150 minutes per week of moderate exercise intensity is recommended, as Dr. Varun has already told, or 75 minutes per week of vigorous exercise. It is recommended. You should do that. You should do social interaction, adequate rest. 8 hours of sleep is must. Recovery. You should give your rest your body so that it can recover. Water intake. Adequate water intake is very important even in winter days. Take adequate water intake. Then fruits and vegetable, whole grain, optimum intake of fish, dairy item, low fat milk. Okay, don't take high fat. Even if you are taking dairy, it should be avoided. If you are taking, take low fat. And weekly you can take meats and eggs and all. So this is recommended. Now we'll come back to our main topic, that is the dietary intervention. Okay, so for prevention of lifestyle diseases, what should you do? What the dietary intervention should you do? As Dr. Varun has already discussed some of the dietary intervention, I'll continue on that only. Calorie restriction. Okay, so if you are doing exercise to lose weight, then you are knocking the wrong door. If you want to do exercise, you should cut your calories. Okay, if you want to lose weight, you should cut your calories, not exercise. Exercise will build muscles. It will improve your cardiovascular health, aerobic capacity. but it won't help much help in doing the weight loss if you are taking the wrong diet. So if you wanna lose weight, you should do calorie restriction. Then different types of fasting or intermittent fasting, as Sal has already told, 24, 16, 8, different types of intermittent fasting, 16 hours of fasting, 8 hours of meal time, or 24, 20 hours of fasting, 4 hours, like that, 18, 6, different types are there, intermittent fasting or fasting mimicking diet. Then different types of diet. I will discuss about some of the diet described in the literature for the prevention of the lifestyle diseases, which has already been proven. So we'll discuss that. So let's talk about the calorie restriction. How does it help? What is the mechanism of action? First of all, calorie restriction and whatever you are taking itself will alter the gut microbiome and lead to the metabolic reprogramming. Okay, in a good way or a bad way, whatever it is, it will alter your metabolic state. Okay, glucose metabolism, lipid metabolism, whatever it is, and lead to, or it can prevent the various diseases like NCDs, lifestyle diseases, or cancer. And also, it can affect the therapy you are taking. If a cancer patient is there and it has already been seen, if you change the diet, chemotherapy and the dose will be less and chemotherapy will be more effective. Okay, chemotherapy resistance will not be there by altering the gut microbiota through the diet. Let's start with the calorie restriction. What is recommended? It is recommended for a healthy living, you should do at least 15 to 30% of the calorie restriction per day. 15 to 30%. So just calculate your requirement, calorie requirement of a day and reduce it. If it is 2000, reduce it to 14 to 1700. That much calorie restriction you should do in the healthy living. Okay. It has been seen, it leads to the prolonged life and reduce age-related diseases. And it has a tumor limiting effect. Tumor limiting effect by promoting the autophagy. Like it will increase the apoptosis rates, inhibit the angiogenesis, and so on. This was the hypothesis given in one of the paper. Can you recognize this person? Can you tell me his name? Einstein, Albert Einstein. So this was discussed in a paper. If Albert Einstein started, if he would have started the calorie restriction of only 20% at the younger age, 25-year-old, he would have lived till 81 years of age. He died at 76-year-old, so he would have lived till 81 years of age. So increase in the life expectancy to more than 5 years or around 5 years. But if he started that at 60 years of old, when he was 60 years of age, at 30% of calorie restriction, the increase in the age was only 2 months. So introducing calorie restriction at an early age is very important. Like at your age, if you are at 25, 28, you should start now to live your life healthy, preventing lifestyle diseases and prolong it, along with exercise, whatever you want to do. When we were the MD students as AIMS Delhi, it has been taught to us diet chart, making diet charts for a healthy person, for calorie restriction, for different types of diseases, diabetic, renal, whatever it is. You should know. I tell my students, all the MD students, you should know how to prepare a diet chart for anyone. You can also try yourself. You only have to know, you just Google it, you have to know how much calorie a bowl of rice has, one chapati has. And on the basis of age, activity, weight of a person, you can calculate his calorie requirement and make a diet chart. Just divide into different meals. You will have a diet chart, and you know where you have to limit yourself. What is the what is the mechanism of calorie restriction? As I already told you, so many affecting the, apart from affecting the microbiota at biochemical level, at what does it do? First of all, it is promoting the good bacteria, which itself lead to production of some of the chemicals which will promote the healthy living. What are those? Like AMP kinase. Dr. Varun has already talked about. AMP kinase lead to increased production of a specific enzyme, superoxide dismutase, which will neutralize the free radicals produced in our body due to oxidative stress. So it is neutralizing that, decreasing the oxidative stress. Similarly, at the same time, increasing the production of nitric oxide from the epithelium in us. Epithelial nitric oxide, super oxide, it is increasing synthase, it is increasing the production of the nitric oxide. Okay. Then some of the genes, it is promoting genes like sirtuin gene, it is promoting the gene epigenetic level, so promoting the gene expression, so autophagy. Then some of the chemicals which will disintegrate, integrate the extracellular matrix, it is reducing the activity of that. So stiffening won't happen, ECM deposition won't happen, okay, and the hypertrophy of the vascular smooth muscle won't happen. So ultimately all of these factors which is directly related to your diet will lead to the good healthy vascular endothelium and decrease in the blood pressure or maintain the blood pressure healthy level. Cancer prevention by simply promoting the good bacteria, acetate, which is a SC, short chain fatty acid. So by promoting that good bacteria and producing the short chain fatty acids, acetate, one of them are basically increasing the cells which are promoting the or killing the cancer producing cells like CD8 plus T cells. So limiting the cancer progression. Second is fasting or fasting mimicking diet. Okay, fasting is there in our culture since ages. Mahatma Gandhi used to do that, fasting for so many days. 9-day fast is there in different types of cultural events. In different communities, 40 days, 45 days fasting is there. In Roja, they do that. Why they are doing that? Because until from ancient time we know that fasting as a health promotion, okay, or prevention of various type of diseases. That's why we tend to do that. Now we have the evidences. Okay, so what do you understand by the fasting? Fasting encompasses a range of eating patterns including complete and voluntary deprivation of the food with no restriction on drinking water. In some of the forms, they don't take water also. Okay, but it is not recommended at all. You do fasting, but take lot of water. Okay, or different types of fasting like intermittent fasting. Okay, like short-term fasting, fasting mimicking diet, in which you are taking a specific diet which will mimic or have the advantages of the fasting. And then time-restricted feeding, like as I already told you, 24, 16, 8, different types of time-restricted. In that time only you will take your meal, and other time you won't take anything apart from water. Okay, like in fasting mimicking diet, low calorie and low protein foods are taken. Okay, that mimics the effect of fasting. You see, different types of fasting, intermittent fastings are there. Okay, I'm not going too much of detail of that. What does it do? What metabolic changes does fasting lead to, or fasting mimicking diet lead to? It basically changes your metabolic program of your body. You see, it affects the levels of insulin, growth hormone, okay, glucocorticoids, adrenaline. It affects that. It decreases the level of that. Okay, and in response to that, cell develops a protective mechanism. Cell react to developing the protective mechanism which will be beneficial for us. Okay, and another type of dietary approach which was specifically developed for the hypertension is called dietary approach to stop hypertension. Okay, stop hypertension. You see, in this also, fruits and vegetables are promoted, fat-free dairy products should be taken, whole grain, various protein sources you should take, limit consumptions of added sugar, saturated fat you should limit, sodium intake you should limit to the less than 2.3 gram per day. Okay, so according to normal dietary recommendation, more than 5 gram of sodium you should not take, or more than 10 gram of salt, 10 to 12 gram of salt you should not take. But specifically for this diet, sodium restriction was done to less than 2300 milligram per day. Then some of the famous diets, Mediterranean diet, Atkins diets are there, detox diets, Paleolithic diets, so many diets are there. You see, Mediterranean diet, again, fruits and vegetables are promoted, okay, moderate intake of egg and all you can take. And also some of the components of Mediterranean diet has some active compound, biochemical compound, which helps in your healthy living or preventing the different types of diseases, like polyphenols, which is present in pasta. It has been seen that this ingredient actually has a positive role in the protection of kidney cells from the oxidative stress. So chemical, what are the chemical present in your specific diet is very important, okay. Then if you combine Mediterranean diet with the DASH, it is called a Mediterranean DASH intervention for neurodegenerative delay. So this was combined to prevent your cognitive delay, neuroprotective. So if you combine both, it has a neuroprotective delay. So a specific type of diet is developed to prevent the cognitive health, okay, neurodegeneration. Okay, so similar type of diet is there. And unhealthy, the diet which is unhealthy for the brain is avoided in this, like red meat and all. Then ketogenic diet, okay. So it was developed by Dr. Russell in 1923 for the epilepsy because it has some hypoglycemic effect and it leads to the control of the seizures or delay seizures, or so it has been seen that it has its own benefit in lifestyle diseases. What does it do? What does it have? Ketogenic diet. If you see, ketogenic means it will lead to the production of the ketones. So it comprises of the high fat component and low protein and low carbohydrate component. So generally it is called a very low carbohydrate diet, which has a ratio of fat and protein is 2 carbohydrate 4:1. 80 to 85% of the calories taken from the fat only, okay. It has an effective lowering glucose level and promote potential anti-cancer effect by increasing the level of ketone bodies. So some different types of keto diets are there, okay, but it has some own risk because you are taking a high fat diet, so you are not taking fiber, okay, and also some micronutrient you are lacking, okay, like vitamin A, B, calcium, magnesium, minerals and all, some. What does it do? How does it promote healthy living? Okay, so because of the ketone bodies, actually ketone bodies promote the normal endothelial function. It promotes it by decreasing the oxidative stress, promoting the epithelial nitric oxide production, okay. And at gut, if you see, hydroxybutyrate, specific bacteria which will lead to the production of these ketone bodies at the gut. So see, it is promoting the tolerogenic bacteria which are good for us and inhibiting the immunogenic bacteria which is bad for us, okay. These production of the ketone bodies and leading to the decrease in the pro-inflammatory cells, TS17, a specific type of T cell is there, helper cell 17. It decreases their number, which is pro-inflammatory. So it is reducing the inflammation at the gut level. Then some of the protein restriction diet. So if you see some of the specific diseases, protein restriction diets are recommended, like in kidney diseases and all. So one of there is protein restriction diet. So generally it is used to be said at old age you should take more protein, but evidences has said that below 65-year age, high protein diet lead to the increased mortality. So at old age, it is good to take high protein, but before 65, it is not recommended. Protein restriction diet is recommended actually before 65, okay. In this intervention, you can limit some of the specific amino acid also, which has a positive impact, okay, like serine, methionine, branch chain amino acids, some of them. Or you can promote taking some of the other amino acids like tryptophan, which has a positive effect, Okay, so if you see, it is promoting, if you are taking it a diet, it is promoting good healthy bacteria in your gut, like lactobacillus, okay, bacteroids, which are again producing some of the chemicals, which are acetic acid and all, which will lead to the increased efficacy at the immune checkpoint blockade. Means at the immunity level, it is increasing your immunity, and also if it is a cancer patient, it is increasing the chemotherapy, efficacy of the chemotherapy. Atkins diet, another very famous diet developed in 1960s by the cardiologist, okay, to have a weight loss. And still till date, if you see, if you compare all the diets, maximum weight loss occurs in the Atkins diet only. Okay, it is a very good diet. Okay, and it is promoted as a very quick weight loss plan. Okay, and it involves very extreme reduction of the carbohydrate intake, less than 5%. But protein and fat you can take ad libitum, whatever you want you can take, adequate food intake, fluid intake, and exercise is promoted. And it has various phases in which you will see your weight loss actually. Okay, and you can maintain it for the lifelong. So in these 4 phases, lifelong maintenance is recommended. So you will see, you will start with the induction in which weight loss occur because you are taking less than 20 gram per day of carbohydrate. Then in the second phase, when ongoing weight loss is occurring, in fact you will increase your carbohydrate till date, you will weight gain again. Then you will enter into the pre-maintenance phase, where again you will decrease the carbohydrate. Okay, and you have to see at what level of your activity you will maintain your weight loss. At that level maintenance, you can take around 40 to 90 gram of carbohydrate apart from all the nutrients and maintain it for the life. That's how Atkins diet is promoted. Then very famous diet, vegetarian diet. One of the form is vegan diet, very much promoted nowadays. Okay, so in this, animal products are banned. You cannot take animal products. Okay, different types are also there. Like some of the animal products are allowed in some of type of vegetarian diets. Like lacto-ovo-vegetarian, you can take dairy or egg. Lacto-vegetarian, you can take dairy. Ovo-vegetarian, you can take only egg. Vegan, total restriction. But in vegan also different types of diets are there. You see, vegan general, animal totally restricted. Raw vegan, even ultra processed food, oil, refined oil, ready-made foods, and legumes are also restricted. Whole food vegan, only whole grain, vegetable. So these different types of vegan diet is also there. Detox diet. So different types of diet are there which will cleanse your body, toxins from your body, cleansing diet. Okay, like liver cleansing diet, lemon detox diet. It consists of 10 days of diet, only liquid. You cannot take any solid food, okay, only liquid. Clean Kings, Martha's vinegar, Fat Flush, Blueprint, so many detox diets are there. Promoted to cleanse your body from any toxin present. High fiber diet. Again, altering the gut microbiota, promoting the bacteria which is producing the short chain fatty acids, different types, acetate, propionate, butyrate, and decreasing the chances of cardiovascular disease and all. I am not going into too much detail. So, to summarize that, if we conclude, what are the effects, actually effects of these diets? Okay, so like Atkins diet, promoted weight loss, okay, it has the major weight loss. Ketogenic diet is neuroprotective, okay, and it can lead to a greater long-term weight loss also. It was developed in the epileptic patients. Mediterranean, preventive therapeutic potential many chronic diseases and have very less side effects. Mediterranean diet, lesser side effects, okay. Vegan, although lower cardiometabolic risk are there, prevention from the prostate cancer is there because the higher fiber intake, okay, it is there. But some of the health consequences are also there. Like in Atkins, high protein intake, stone formation, kidney disease can develop. So you have to see, okay. As I already told you, ketone body production is occurring, so LDL, because you are taking in ketogenic high fat diet, so it can lead to increase dyslipidemia, increase LDL and TG. Vegetarian, I already told you, has good potential of cardiometabolic risk, decrease it, but nutrients are not there. Some of the vitamin deficiency will definitely occur, like vitamin B12 and D, because it is not there in the vegetarian meal. So, to sum up all these, diet and NCD will have its effect on every aspect of your body. Whatever you take, okay, it can limit the obesity or promote it, diabetes mellitus, NAFLD, PCOS, whatever you see, it is related to the diet itself, okay. One type of diet you are taking, it is limiting it. If you are taking other type of diet, it is promoting it. Autoimmune diseases, it has its own role in autoimmune disease itself. So, absence of physical activity is there. You wanted a rapid loss. You wanted to promote short-term changes, because you see, these diet can only lead to short-term changes only. Not many will have for the long term. Maintenance issues are there. Nutrient deficiency is there in each type of diet. Scientific evidences you have to see. Some of the evidences I have produced, some of the evidences you have to see. And some of the diets are detrimental for different types of diseases. Like as I already told you, high fat diet can lead to increased LDL, dyslipidemia and all. Some of the diets which has high protein can lead to kidney diseases. So this is our team which we did conference at BHU, ICCM Con second conference. This is our team of AIMS Patna. We did SOPCon recently in October at AIMS Patna. This was my team when I went to Commonwealth Game, Glasgow, Scotland. Boxing team, Indian boxing team, you can see Vijender is there, 3 silver medals from that team. Thank you very much. If you have any queries, you can ask me.
Anyone has any question?
I think
Thank you, sir.
Clear.
That was an eye-opener for many of us. Now I would like to request our chairperson, sir, Professor Dr. Shoibal Mukherjee, to felicitate our speaker by giving mementos and certificate. Now I would like to request Astha and Jagandeep to bring the mementos and certificates to the stage. Now I would request our chairperson, sir, to give his concluding remarks about the session.
First of all, I must thank Dr. Gagan for enlightening speech, and I'm sure many of you follow the word Gyan Papi. Do you understand what is Gyan Papi? Committing nuisances in spite of knowing what is true. That is the person who does it is a Gyan Papi, we all of us. Maybe, I don't know, he is not, but most of us. And especially when you listen to his speech before the lunch session. I wonder how many of you will be avoiding the things which are there and follow him. So it is difficult. That is why probably the physiological techniques are not as popular. It is very easy to consume some pills to get rid of your disease like that, so-called. But to prevent, you have to start it very early, and you have to follow it very meticulously throughout your life, which is very difficult. So our days are gone. It's for you people only to follow. To get rid of, at least not to develop certain diseases, which we know, and the menace is probably most important, is the obesity. It is rising, 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 and rising all over the globe. And other diseases are also there, so he has mentioned it very nicely. But I would suggest, because you have time, most of the audiences, you have time, so you try to follow, because discipline is going to be the ultimate medicine in your life in future. To not to have certain diseases while you grow. Thank you.
Sir, now I would like to call upon the stage Professor Dr. Kunal sir to give a token of gratitude to our chairperson. Yes, sir.
Now I take my privilege to welcome our next speaker, the organizing secretary of this event, Professor Dr. Kunal sir. He is our yoga guru, MBBS, MD, PGDYS. He is professor in the Department of Physiology, MGM Medical College, Kishanganj, has been a resource person to more than 25 international and national CMEs, webinars, guest lectures, workshops, etc. He has 30 years of experience of learning and practicing yoga and has been teaching yoga and physiology for 15 years. He has conducted numerous research investigating the impacts of different yoga practices, presented his findings in various national and international conferences, published many original research articles in reputed journals of high impact, and received Best Paper Award in multiple conferences. I would like to request our first prof student, Manpalak Jot Kaur, to guide Professor Dr. Kunal sir on the stage.
हाँ बोला ना
To chair this session, I would like to call upon stage Professor Dr. Ashima Bhattacharya Madam, Head of the Department of Anatomy in Mata Gujri Memorial Medical College, Kishanganj. Caller mic. अभी नहीं बाद में अभी नहीं सर कॉलर नहीं है नहीं सर को अच्छा नहीं कॉलर होने से अच्छा था ना? कॉलर तो है लेकिन इसमें ना साउंड क्लियर आता है। ओ ऑनलाइन शिवाजी भैया दीजिए ना, सेट कर देते हैं ऑनलाइन में। अच्छा कॉलर में ऐसे हिलता है तो सर ये देखिए ये क्या रहता है, आवाज पूरा एक ही फ्रीक्वेंसी में आता है। सर एक बार सर पॉकेट में मोबाइल नहीं है ना?
नहीं नहीं
एक बार सर लॉक खोल दीजिएगा। चार्ज हो रहा है सर? सर चार्जिंग हो रहा है?
चार्जिंग
सर चार्जिंग ले लिया?
Good afternoon, students. Good afternoon, sir. Good afternoon, all the delegates, and outstation faculty, and outstation delegates who are connected with us online. Good afternoon to all of you. I hope you are having energy to listen to this. How are you? Cheered up? Happy with the sessions? Good. So let's learn something about physiological aspect of yoga. Okay. How yoga practice facilitates healing, a scientific insight into the ancient wisdom. I'll be covering this asana, pranayama and meditation. Okay. Then what is yoga and how practice of Ashtanga yoga brings total health. So what is asana? All of you know asana? Have you seen asana? Question is asana another form of exercise? Okay. What about nursing students? Is asana another form of exercise? Quite. You can say yes or no. Only two answers. Okay. Many people think asana is a form of exercise, but no. Practice of asana is opposite to exercise and better than exercise in most ways. Okay. Now let us look at some basic physiology. Exercise aims at multiple contractions, right? Because of which there will be up to their maximum endurance. How many times you can contract up to your endurance, you can go on exercising. Because of which there will be increased metabolic load and fatigue of the muscle at the end of exercise, right? Everybody gets tired. You cannot go on exercising 24 hours or even 5-6 hours or even 3-4 hours. But in long run, you do improve your strength and endurance. On the other hand, yoga aims at prolonged stretch. Okay. Now, let's take reference a leaf from the first session. Does somebody remember which exercise is better to burn glucose or increase the strength? Sir told in the first session. To decrease blood pressure, resistance, or in other words, isometric exercise. What do you mean by isometric exercise? When the length is constant. When you are moving the muscle, you are changing the length continuously. Because of changing the length, movement is happening. Only when you hold your muscle in a certain position, the length will be constant. And you know all the yoga postures facilitate holding the muscle in a particular position. All the yoga postures are isometric exercises. But not only that, suppose let's take an example of hand grip versus yoga posture. What is the difference between a hand grip and an yoga posture? I'll get to that later. Yoga posture will stretch the muscle. Okay? Whatever posture you are making, you are contracting certain body parts, but that asana, that posture is not meant for that muscle which is contracting. It is actually affecting the other muscle which is getting stretched simultaneously and maximum stretch. As you see, many people cannot perform all the asanas. Cannot perform means you don't have that range of stretch. And as you go on practicing, you develop range of stretch and you are able to perform. That means yoga helps in lengthening of the muscles. Okay? So when you stretch the muscle, you lengthen the muscle, you hold the muscle, isometric, but along with the stretch. Now, all of you know the physiology. What happens if you maximally stretch a muscle? The muscle will relax immediately. That's a protective phenomena we have in our body. Right? That is called inverse stretch reflex. Have you heard of it? The moment you stretch a muscle, it will be relaxed. But even at the end of asana, you develop more strength and you develop more endurance. It's not that because just stretching is happening, your strength and endurance are not increasing. So you have similar benefit, but physiology is exactly opposite. Let's understand how. This is what I was talking about. Overstretch of a muscle causes sudden relaxation of the same muscle, also known as inverse stretch reflex or lengthening reaction. All of you are aware of it. It's all there in the physiology textbook. It is maintained by a Golgi tendon organ, and it's a very well-known reflex. It's nothing hidden. Everybody knows this. Just application wasn't there. Okay? So yoga asanas are based on this this protective mechanism that is called inverse stretch reflex or lengthening reaction. Okay. Now, benefit of lengthening of a muscle. You see this length tension relationship. It's also called as Frank-Starling law. Here, if you increase the length from 1.25 to up to 2, there is a continuous increase in the force of contraction. So the more you stretch the muscle, better it develops the force of contraction. After 2, you cannot increase the force of, because this is the resting length, and if you stretch it more, it will decrease the force of contraction. That is non-physiological stretch. It is not possible in intact human body because we have origin and insertion of muscle from skeletal framework. Right? Now, what is the problem? We know that stretching helps, and this is called resting muscles, resting tension or resting length of the muscle. But why do we need to stretch it more than resting length? Because at rest, muscles are not resting. All the muscles have a certain amount of partial contraction. That is called as of the muscle. If you don't have certain tone, you cannot maintain any posture. So all 600 muscles in the body, they have certain amount of tone to be able to give the posture, the body posture, subconscious posture you have. So we need to stretch the muscle to get it to the resting length, and that is where yoga works. Yoga increases the progressive relaxation, and example of this all of you know, javelin throw, shot put throw. I will not get into that. So most of the muscles at rest remain in a state of partial contraction, and this is the proof. You know, as we advance in the age, we develop wrinkles, right? Wrinkles is not because of weakness of the muscle. Wrinkles are because of excessive contraction of the muscles, and that is proven by the fact because we have to inject a toxin to relax that muscle to look young. You know what is that called as? Botox, botulinum toxin. People inject botulinum toxin to relax the muscles to look young. And on the other hand, if you just practice asana, regular practice of asana is a natural Botox. Right? You don't find any wrinkles on my face. Right? I'm approaching 50, 47 running. Right? So, practice yoga. Okay. Now there are multiple publications that I will be covering in the next talk. Here I have just taken one or two glimpses which says that in healthy population or disease population, when it was researched, they always found that yoga is as effective or better than exercise in nearly all outcome measures. Okay? May be equal, or superior to exercise in nearly every outcome measured, except those involving physical fitness. This the technical term, you have to read the article to understand that. And just to tell you, I have not taken any example of regular publications. Most of my examples are quoted from the review articles, either meta-analysis or systematic reviews, all high-end impact factor, highly cited publications are all there. That I will show you in the next session, not in this session. This is another paper, is there more to yoga than exercise? And they say yes. Only yoga practicing group experience decreased anxiety-related symptoms, decreased salivary cortisol from the beginning to the end of the study. It is not surprising to notice that exercise increases a little bit of stress level. So if you just measure salivary cortisol or some other stress, it will be more while exercising, it will be less in yoga. But that does not conclude anything until unless you have to show the long-term study with the health outcome measures. Okay, so there are many citations. These are the citations which I have taken. These are the papers. They are published in good journals. We have highly cited articles. Okay. So exercise is good, must be done. Don't take a bad message that I am talking bad about exercise. Okay? But if one has to choose, yoga is opposite to exercise in many ways and better than exercise in nearly every parameter. But most people actually exercise in the name of yogasana practice. So how to practice asana as yoga, not as exercise? So there is small, deep-seated information. Not even yogis talk about that. There are 4 aspects of asana practice. Let's understand those 4 aspects. They are called as swasa, vinyasa, sthiti, drishti. Okay? Now, whenever you practice asana, vinyasa means the sequence of contraction of muscles, one after the other. There is a prescribed sequence that in this sequence you should contract your body parts to get into the final posture. Not simply padmasana karna, बस कैसे भी मोड़ करके बस पैर घुसा लो और sequence में आ जाओ, position में आ जाओ. With the sequence of contraction and relaxation, you should have your breathing control. During which contraction you should exhale, during which contraction you should inhale. So you should have breath awareness. And then you should hold the sthiti, hold the posture for certain duration of time. They say minimum 5 deep breath or 1 minute. You should hold each posture for minimum 1 minute. While holding the posture, it is prescribed that where should you see, where should you look, where should you focus, that is drishti. So remember what? Vinyasa, shwasa, sthiti, drishti. Right? Let's repeat once more. What? Vinyasa, shwasa, sthiti and drishti. Remember, if you go to learn yoga, ask yoga master to teach you this with each asana. If they don't know this, don't go to them again next day. Okay? Definition of asana is very simple. Sthir sukham asanam. You should be stable and comfortable. Prayatna shaithil anant samapatti bhyam. Now this is very technical, a little bit of mysterious. Prayatna, effort, shaithilya, cessation. Anant, infinite, samapatti, meditation, concentration. So there are two ways you can interpret it. Because of practice of yoga, there will be cessation of your effort, it will be effortless, and because of which you can concentrate for long time. You can concentrate for infinite. Another interpretation is, if you are having difficulty in practicing asana, focus on the infinite. By anant samapatti, you will have cessation or you will be comfortable. Pratna shaithilya will come and then it will to practice asana. Okay, it will be less effortless, more effortless. What is the benefit?
How will you know that now you have practiced asana, now you know the asana? Tato dvandva anabhigata. Thereafter, one is undisturbed by the dualities. If you are taking an asana, you will not be disturbed whatever happens around. You know, when I was in MBBS first year, I was walking outside. My shoe or chappal was making some sound. One senior called me in, shouted badly at me, I am reading for my final year exam and you are walking with this so much of sound. I got distracted, don't you know how to walk? This is the dualities. He was not yogi. Okay. And most of the people, you must have heard this kind of word, you are disturbing me. Nobody disturbs other. They are disturbed from inside. Okay. So you are not disturbing. Take it like they don't know. जैसे Jesus ने कहा था ना, forgive them because they don't know what they are doing. Right? So if you practice yoga, you will be undisturbed with whatever happens around. You will be stable in your posture, you will be comfortable in your posture, and you can focus for long, long time. As per the textbooks, benefit of asana is kuryat asanam stharyam, arogyam, angalaghavam. You will get stability, you will get health, arogyam, and you will get lightness in the body. Now, most of you, when you go back home at 5 o'clock after your work and schedule, all of you feel tired. If somebody asks you to do something, you feel, especially if your spouses, mother, parents are there around, you want them to serve you because tired, because heaviness of the body. If you practice morning yoga, whole day you will feel so light, you will feel like running. Until you hit the bed in the night, you will not feel like sitting and taking rest. This is the benefit of yoga practice. Angalaghavam. You will feel, your weight will remain same, but you will feel light. And how and all that happens, I will be explaining in the next session because that has got a little metaphysical explanation. Okay, so let's see some scientific explanation. Okay, we saw enough. So asana is yoga, right? Right? Not exactly. Asana is one of the smaller preparatory aspect of yoga. Okay. Let's, do you know this? Any of you? There is one vital function in the body which is free from autonomic regulation. Sympathetic, parasympathetic nervous system don't regulate it. But that function regulates both sympathetic and parasympathetic system. Can you name one function of the body? Okay, yeah. The answer is breathing. He was listening to my lecture during the foundation class. Okay. Any disagreement? Any of you feel breathing is autonomic? If you feel that, go and read about Ondine curse. Okay? Let's understand to believe it. Okay, this is the normal recording of the heart. It is called as sinus arrhythmia. We all feel that heart rate is regular, but it's not regular, it's irregular, it's arrhythmic. Our sinus node fires arrhythmically, not because of its own inherent property, because we are inspiring and expiring. With each inspiration and expiration, as you see, RR intervals are shortening and getting lengthened. Exhalation reduces the heart rate, inspiration increases the heart rate. Okay, and since yoga concentrates more on deep breathing and expiration, there is an increase in parasympathetic activity, decrease in heart rate, decrease BP, increase anabolism. Exactly opposite to exercise, right? At the end of exercise, you have increased sympathetic activity, increased heart rate, increased blood pressure. सर ने बोला कि अगर 200 से ऊपर बीपी है सिस्टोलिक तो एक्सरसाइज नहीं करने का, लेकिन योगा करने का, योगा विल ब्रिंग इट डाउन. अगर डायस्टोलिक 125 से 126 से ऊपर है तो एक्सरसाइज नहीं करने का, क्या करने का? योगा करने का. It will bring it down. There is no way yoga can increase your heart rate and blood pressure. Okay? But you see, what we are talking about, yoga means breathing. Breathing has to be a very, very essential component if you are practicing yoga. Your breath has to be managed. Deep breathing should be continued all the time. Okay, so there are plenty of evidences regarding sinus arrhythmia. I will skip that. Just come to this. It is taken from Ganong. You see, as we advance in our age, 79-year-old man has increased heart rate but decreased variation in that of heart rate, that is sinus arrhythmia. But a 22-year-old male, like little older than many of you, have lower heart rate, 50 around, but very much falling up and down with each respiration. Okay, during this recording, subject was breathing only 5 breaths per minute. Okay. So greater the variability is a better index of cardiac health. Okay. More variable heart rate means better is your heart, condition of the heart. And yoga brings it back. With the age, we lose this variability, but with the practice of yoga, we bring it back. I don't know if exercise brings variability to like older. So everything has effect, but yoga is proven to bring the heart rate variability back to your younger age. As per yogic textbook, prana means life energy. Prana is not oxygen as per yogic textbook. Prana is a way to control the fluctuation of autonomic tone. And you will be surprised to know that we have some fine channels. Yoga textbook says there are some fine channels through which prana flow. Pranic, we don't know, it's metaphysics. So let's just focus there. It has to do with the neuronal system. There is some activation of parasympathetic system. There is some activation of right and left brain, depending upon which kind of pranayama you are doing. Let's take example of Anulom Vilom. That creates the balance because it's alternate right and left nostril breathing. That creates a balance between the right and left brain. So whenever we talk about pranayama, we're talking about cleansing of nervous system, regulating the nervous system and restoring the balance of nervous system. I would like to point out this particular finding, 2009 Nobel Prize. See, Dr. G. Smenja, William Kaelin, and Peter Ratcliffe, they discover HIF, hypoxia-inducible factor. The more you hold your breath during pranayama, the more hypoxia you create within you, and exercise does the same thing, right? It creates hypoxia, oxygen debt, you are panting. Okay, and there are panting type of pranayama also. So understand the science of, you are not tiring your muscles, you are not producing lactic acid, but still you are developing those conditions in the body which the benefit exercise is going to create inside you. You are going to increase the blood flow by stretching the muscles. You are going to increase the hypoxic inducible factor, which are very potent growth factor. They create angiogenesis, increase in the blood vessels in different organs, especially in the heart. Okay? Because heart has got plenty of end arteries, so you need lots of collaterals there. And there is angiogenesis here, you see. More HIF formation, more angiogenesis will be there. And metabolism will shift towards anabolism. Okay, so I did not tell you what is yoga. Is pranayama yoga? Let us look at this shloka. Sparshan kritva bahirbahyansh chakshus chaivantre bhruvo pranapano samay kritva samao kritva nasya bhyantar charini. Charino. Okay, now what does it tell is sparshan kritva. Whatever is external touching, external sensation, leave it bahirbahyansh. Leave them all outside. Okay. Pranapano, chakshus chaivantre bhruvo. Focus your eyes on the eyebrow center. Then pranapano samao kritva. I'll talk about this in the next session. What is prana, what is apana. There is a detailed description of it. उसको balance करके, मतलब breath को balance करके in nutshell, क्या करना है? नास्याभ्यंतर चारण, धीरे धीरे breathing. मतलब it should not be a long. It's a very big, there are very big explanations about the length of breath in yogic textbooks. Okay, your breath, length of breath should be small. So small that it just moves within the nostrils. Nasya bhyantar charino. Within the nostril, your breath should move. That means you should breathe as slowly as you can. It's not shallow breathing, it's deep breathing. Because you're breathing slowly, you have to go on breathing for longer time. Okay? It's a deep breathing, but slow and deep breathing. So, how to equalize this prana and apana? This was the explanation of meditation. This is how meditation begins. Okay? Although meditation is just one of the level of Ashtanga yoga, but in reality, yoga is all about meditation. Just meditation and meditation. Let's understand how. What is meditation? Minimum 20 minutes of concentration leads to meditation. Tatra praktanata dhyanam. What is concentration? Deshbandh chittasya dharana. Desh means space. Bandh means holding. Chitta means mind. Holding your mind at one particular space is concentration. Everybody wants to concentrate. That is what is going to give you everything in the life. If your concentration remains for more than 20 minutes, that means you are a meditative person. Normal medical research says that an average human being cannot concentrate for more than 15 minutes. Okay. If you can concentrate for more than 20 minutes, that means you are doing meditation. Now, what is the benefit of meditation? Why shall we meditate? You get to realize all the meanings in meditation. Everybody meditates, whoever is whatever. Let it be a businessman, let it be a mistri who is making a building, let it be a sportsman. Everybody meditates. Without meditation, they cannot become master. If somebody is master of an art, they are meditative, inborn meditative. Now, why shall we meditate, or how shall we meditate? It's like, see, we have business schools, right, to do MBA. But most of the businessmen, they have not done MBA. Most of the great businessmen. But people are going to business school to do MBA. What is the benefit? MBA curricular have been designed in such a way, looking, reading, studying those businessmen who became successful, that if you follow this kind of pattern, your life, you yourself can become a businessman. So whoever is businessman, if they go to MBA, it will be beneficial for them. They will learn one or other things. Those who are not businessmen, they can become businessmen. This is the benefit of learning to do meditation. You are all meditating, more or less. But if you get it taught in a proper manner and learn it properly, you will improve from wherever you are. And what will happen then? Tadeva arth matra nirvasam, sharupa sunyam iva samadhi. Now, people think samadhi is the big thing. No? But look at the definition. After long meditation, tadeva arth matra nirvasam. Only the meaning remains in your brain. You forget about yourself. Do you remember people who realized things forgetting about themselves? They did not know anything about themselves, but they were totally lost into the thing they were thinking about. Remember any example? Remember Eureka moment? I gave you example. Eureka, Archimedes ran naked because his king asked him, okay, I want to know the purity of gold. I don't know how. He was thinking how to know the purity of gold. There was no way. He was taking bath in the tub. Tub was filled to the brim. Then he took an empty glass, or he took the soap in the tub. Some water fell out. And that was Eureka. Oh wow, I got it. He ran naked. He was not into his body. Tadeva arth matra nirvasam, swarupa shunyam iva samadhi. So that is everybody who has achieved something, calculate benzene ring structure, just it came as a flash. You know how gravitation was discovered? Apple fell and Newton thought about the gravitation, law of gravitation. And then he went so much into that, he discovered a new branch of mathematics to explain gravitation. Calculus discovered to explain gravitation. So first gravitation was discovered, then another branch of medicine was discovered to calculate gravitation. Imagine that state of mind. Tadeva artha matra nirvasam, swarupa shunyam eva samadhi. So every discovery, every achievement has come out of samadhi. Yoga is just a way to teach each and every one to reach to that higher state. That's the benefit. Yoga karmasu kaushalam. Whatever you do, you'll become skillful if you practice yoga. It's all about mind. I did not finish. Okay, I gave all this example. Okay, it is our factual science has proven that it increases the cortical thickness after meditation, and because of this, it was a small experiment. They were long-term Buddhist monk, long-term meditators, and their cortical thickness was found to be very, very higher compared to the normal population of the same age. Okay, age-related cortical thinning was not seen. Okay, and this is very, very important. What very, very interesting. All these meditators, they were found to be very sensitive, but less responsive. Imagine the contradiction. If you are sensitive, you will be responsive, right? Those who are more sensitive, they are more responsive, right? If somebody tells you something, you start crying if you are more sensitive. If you are less sensitive, it does not matter to you. But how somebody can be more sensitive but less responsive? Because in between your brain is working. You are observing, you are receiving, you are very alert, but you are analyzing, do I need to react on this? Is there any benefit of my reaction? Is it need? So because of regular yoga practice, you become less responsive but more. Isn't it this we all want from our life? Become more alert, more sensitive, but less responsive. We don't want to react to every Tom, Dick and Harry, right? We want to react to only those stimulus which are going to benefit us. And yoga gives you that, especially meditation. Prefrontal cortical thickness, this is what helps you to calculate and analyze things before you react to it. And imagine that were most pronounced in older participants, those who were practicing yoga. It's supposed to be thinning with the age, but it wasn't seen with the meditation practice. Okay, likewise, many examples are there. This is one very, very interesting example, amygdala. Okay, this is why you become less responsive. And not only, so amygdala is what? It's a window to the self from external world. You will see yourself how others see you. That is your amygdala. And this is the region of stress. ठीक है, लोग क्या कहेंगे? सब लोग उसी में परेशान हैं. With the regular practice of yoga, your amygdala becomes smaller and smaller, less functioning. So you do not care who is doing what, who is saying what. This is what we want. You live within yourself. Okay? You don't care about external world. You're less stressed. So with the proper practice of yoga, not only asana, I told you benefit of asana is helps in the muscle. Benefit of pranayama is cleanse your nervous system. So those two are enough to make you healthy. But meditation is what is going to raise you from what you are, further up, higher up. So yoga is not just for fitness, it is for achievement. It is for raising yourself, first making yourself fit and then getting higher and higher. So this is what I had explained. And everything is very interesting. Increase cerebral blood flow, but cessation of CO2 generation by muscles during the practice of deep meditation. This is what we want. We want to create less metabolic load on the body, generate less CO2. Less CO2 means less utilization of all the resources. 5-fold increase in plasma AVP. Synchronized EEG, increase in amplitude. Usually that is seen only in the deep sleep, but it is also seen during meditation. So they also say that if you practice half an hour meditation every day, that is equivalent to 2 hours of sleep. And most of the yogis, they don't sleep for more than 3-4 hours per day, because they meditate for half an hour, 1 hour per day. So 1 hour of meditation is equal to 4 hours of sleep. That's what they say. And I do practice that. So this is the conclusion of meditation, highly effective in increasing the cortical thickness, resulting in improved cognition, compassion and empathy, and decreased size and activity of amygdala, resulting in reduced stress, fear, anxiety and depression. This is what everybody wants, and you will get this by practice of meditation. There is no other way you can achieve this. Increase in empathy and decrease in stress. Empathy means being sensitive to others' feeling. Okay. So what is the need of meditation? I already explained to you. Okay. Is getting an MBA degree is only way to get success in business? No. Then why should we go to college? Because, okay. This is one important thing, okay. Sleep physiology. Body rests during the sleep, mind doesn't. No. Actually, body also doesn't. Body rests only during the some 10 minutes. Most of your 90-minute sleep cycle, 70-80 minutes are NREM sleep, where muscle tone decreases slightly. Last 10 minutes is REM sleep, where actually hypotonia happens, prominent hypotonia. Likewise, your brain is highly active. All whole day ka work is analyzed and flushed, whatever is selected memory, your Papez circuit, all the brain, every part is working tirelessly to strengthen your memory, whatever you did whole day. But if you practice meditation, that is the only way to calm down your neurons, which are even firing during the sleep. They can be calmed down only by the practice of meditation. Okay? So if you want to give real rest to your brain, you should meditate. And as I told, everybody is meditating. When you study, when you think about something continuously, you are meditating. You are at ease. And that is going to help the health of your brain. So being born poor is a matter of chance. Whatever you have, whatever capacity you have, it is a matter of chance. But dying poor is a matter of choice. You should not die with the same capacity as you were born with. And there is only way to increase the capacity is practice regular meditation. Means to increase the cranial capacity, meditation will help in doing that. So yoga actually means meditation. How do we meditate? By watching the breath. All of you are hungry. I will not tell you how to meditate now. So let's conclude the session. Okay? Thank you very much.
Thank you, sir. That was an eye-opener for many of us. Now, I would like to ask the audience, do you have any questions? Any questions from the audience? No. Okay. Then I would like to request our...
Hello. I am Ajay. Ajay, you have said that with meditation, during meditation, the amygdala becomes smaller and smaller, and we are becoming that less stressful, or less stress will be there. So the amygdala is responsible for the recent memory, as I know. So recent memory will be less then.
Actually, I may add, because physiological aspect I will add over here. For recent memory, we have prefrontal cortex, and to process that memory into Papez circuit and store that in hippocampus, actually amygdala has no role in the whole circuit. Amygdala is not part of Papez circuit, but amygdala has direct effect on hippocampus. If amygdala is more active, it is known to spoil the memory. It is known to inhibit the hippocampus from forming any more long-term memory. So more, everybody studies during the stress. Like during the exam, they are all stressed. And everybody studies, they mug up everything. They vomit it out in the exam, but they forget everything. Nothing remains in the head. That is the impact of amygdala. Yes. So prefrontal cortex is for short-term memory, and hippocampus is for long-term memory. In between, amygdala has capacity to inhibit both of them. It can inhibit prefrontal cortex, so it can affect your decision making. It can also inhibit hippocampus if amygdala is more active, and that can affect your long-term memory formation. Thank you.
Yes.
There is another question, Dr.
Sir, you mentioned about the meditation. As we know that nowadays lots of different types of meditations are being said. There are some called mindfulness meditation, some focus on awareness, some you mentioned over here, one is transcendental meditation. What are the different types in general somebody who wants to learn about this should be knowing?
Okay, I just give you a gist of it. Everybody is teaching the same thing. Like same wine is packed in different bottles. That's because of patenting problem, legal problem. Because meditation came from Upanishad. Okay, everybody learns meditation from there. I gave you example of Gita, right? Bhagavad Gita. So meditation came from there. Now they have to, in America, especially to sell a product in America, let it be Sudarshan Kriya, inner engineering, transcendental meditation, Brahma Kumari ka Raj Yoga, Buddhist ka Vipassana. Everybody is teaching the same thing. The gist of meditation is what? Sit quietly, breathe deeply, and watch your breath, watch your mind, watch your thoughts. तो mindfulness में क्या बोलते हैं कि ये सब नहीं, ये इतना, you just imagine, be mindful of whatever you are doing, be aware जो भी हो रहा है surrounding में. Vipassana में क्या बोलते हैं? Be aware of your breath, be aware of your how it is moving in and out. ब्रह्म कुमारी में क्या बोलते हैं? इधर एक चक्र का इमेजिन करो, इधर एक भगवान का, वो शिव बाबा का आशीर्वाद आ रहा है. Okay, likewise, everybody is teaching the same thing. Be still and watch yourself.
Thank you.
Thank you, sir. Now I would.
Fajal there.
Okay.
One more question.
Good evening, sir. I'm
Good
very
evening.
thankful for your compact presentation.
Thank
I just want to know, during the meditating state, what it would be? It would be a thoughtless state, or should we think of a particular thought?
Good that you asked this question.
Only a
because
single thought
yeah.
we should
No,
we should think
I
of
tell
that,
you.
or we should
No,
totally
I
thoughtless?
tell
And
you
how
that,
we can do that?
being meditative means being observer. You try not to do anything effortfully. Your only effort is to observe what's happening. Okay, so now what happens, how it goes? If you sit for meditation, watch your breath, watch your posture. Posture should be straight, because then only energy, because it's all about neural science. So if your posture is like this, they say that the movement, energy movement in the neurons or something gets inhibited, gets blocked somewhere. So it should be straight posture. And then you just watch your breath going in and out. In between, thoughts will appear. You will lose the concentration of the breath. As soon as you get aware that I'm thinking something and I lost the count of my breath, get back to your breath. And they say yogic breathing, as I told you, 5 breaths per minute. You should breathe in 2 to 3 seconds, breathe out in 6 to 8 seconds. And keep counting those seconds when you sit for meditation. Slowly, your counting will be disturbed because of thoughts. And as you watch your thoughts, you will come back to the counting. Now the beauty of this is thoughts are like small kids. The moment you tell them, hey, what are you doing? They become quiet. And then they start doing naughtiness after a gap. And each time you stop them from being naughty, the gap goes on increasing. The period of silence goes on increasing. So after some 15-20 minutes of struggle, you find that you are very calm. It's getting longer and longer thought. You're continuing with your breath for longer and longer. And slowly you lose the count of breath. That is the next level of meditation when you become thoughtless. Not because you lost it, because automatically your breathing becomes deeper and slower. You just don't want to count it anymore because you want to lose that also. You just want to get complete calm. So that is the steps of meditation. And whatever are the types, ultimately this is how we have to progress and go. Thank you.
Sir.
Any other questions?
Yeah. Sir, considering our...
Yeah, go on, go on.
Okay,
Go on.
This is the last question. Remaining question can be sent in the as a message and or in the YouTube also. You can comment your question. We will reply to that. Yes.
Sir, considering our hectic schedule, what's the best kind of yoga we can do on daily basis, like stretching and
Meditation, pranayama. Stretching तो दिन भर तुम्हारे एज में बहुत स्ट्रेचिंग हो रहा है. थोड़ा मेडिटेशन कर लो. ठीक है. Morning, as soon as you get up, this is what I practice because this is what all the working hectic. Very nice question actually. Okay, you don't have time whole day. So morning time when you wake up, somehow force yourself to wake up half an hour early, 1 hour early, and sit on the bed in that avatara only. No need to get up and brush your teeth or anything. Just sit on the bed in that sleepiness. Because you woke up half an hour early, you will be sleepy. 1-2 days, you will fall asleep. It's okay. After 3 days, it won't continue. After 3rd day, you will be able to meditate. And you will know the difference because whole day you are more energetic than you were spending that time while sleeping compared to that. Okay, early morning.
Okay. Okay, thank you. Now I would request our chairperson, ma'am, to felicitate the speaker by giving mementos and certificate.
पहले conclude, बाद में.
मैंने बोला था उनको, लेकिन वो मना कर रहा था और रुकता. मैंने अभी बोला था सर, to conclude.
साइवल्दा बोल रहे थे कि पहले सर्टिफिकेट दिला दिया, अब कंक्लूडिंग के लिए बोलता है.
मैंने बोला था अभी. Okay. Okay, now I would like to call upon the stage Professor Dr. Amrut M. to give a token of gratitude to our chairperson. স্যার বলছে আগে কনক্লুড করতে হতো স্যার ওটাই বলছে. Okay. Now I would request our chairperson, ma'am, to give her concluding remarks about the session.
First of all, I want to congratulate you. Very good lecture he has given, and I think that most of you have been motivated by his lectures, and I have seen that he is a very popular teacher to you, and you like his lectures very much. So thank you again. Okay.
Okay, now we shall all disperse for lunch. and we shall resume at 2 p.m. Thank you.
We'll have 2 more sessions after lunch and 1 quiz session. The most attractive one in today's fiesta, a quiz session will be there, and 3 gifts.
ने पिछले महीने 7,000 लगाया, 10,000 हो गए। भैया अपने स्टॉक मार्केट
₹60। यार ये पेमेंट्स कितनी आसान हो गई ना। सही बोला।
welcome you all after lunch. Hope you will all have a good lunch. Before starting the next session, I would like to invite on the stage Professor Dr. Kunal sir to guide us some techniques for post-lunch relaxation. Kunal sir, please come on the stage.
कोई उसकी ज़रूरत नहीं है, ठीक है, लेकिन लगे रहने दें।
सर, माइक, कॉलर माइक?
हाँ।
Those who are present right now, only they will get attendance for the morning session also. Okay? So attendance will be taken now and only that attendance will be counted. Not for the morning session. Not of the morning session. Okay? So, Shashi Bhushan, Dr. Shashi Bhushan, attendance ले लीजिए इनका. Okay.
इसका काम नहीं है सर। हाँ हाँ सर, डिम कर देता है लाइट पूरा, ब्राइटनेस कमाए दवा सर, पीछे वाला जलाते आगे वाला बंद।
Okay.
सर मोबाइल नहीं ना सर?
नहीं. Okay. So there is something called as alpha state. Your mind, your brain turns into alpha state. So we will not only closing the mind, we will do in yogic way. And just after 10 minutes, you will feel the effect of yogic relaxation. Okay. So first thing is keep your back straight. That is the only prerequisite. So that is the only effortful thing you have to do while all the process. Hold through the process, you have to keep your back straight. Keep your eyes closed. Okay. Not leaning back, hello, straight. Sit straight, keep your head straight, back, hip and head in the same line. Okay. Don't bother who talks. Please sit straight. Yeah. Please sit straight. Yeah. Keep your eyes closed. If you are sitting straight, you don't have to open your eyes. Focus on your breath. Don't look around. Yogic breathing is slow and deep breathing. Breathing in 2 to 3 seconds and breathing out in 6 to 8 seconds. So you have to count your breath. First we will do with my counting. Later you do on your own. Breathe in, 1, 2. Breathe out, 2, 3, 4, 5, 6, 7, 8. Breathe in, breathe out, 2, 3, 4, 5, 6, 7, 8. Breathe in, breathe out, 2,
3, 4, 5, 6, 7, 8. Breathe in, breathe out. 2, 3, 4, 5, 6, 7, 8. Continue breathing on your own in the same manner. Don't open your eyes, don't look behind, don't move around. Just sit still. Otherwise, you will not have the benefit of what we are doing. Don't move, don't open your eyes. Sit straight. Those whose back is not straight, please straighten your back. So you have to keep checking 3 things. Back should be straight, breathing should be slow and deep, and then think about your thoughts. Just observe what your mind is thinking right now. Is it feeling sleepy? Is it feeling tired? Is it feeling restless because unwillingly you are sitting here? Just observe your mind. Accept the feelings, whatever you have. It's okay if you're feeling restless. The mantra says, Neti Neti Charaiveti Charaiveti. You just have to tell yourself, not this, not this. Whatever thoughts you observe, just tell, not this. Move on. Charaiveti means move on. Not this, move on. Keep observing your posture. Don't move around. Keep your eyes closed. Don't bother what's happening around. Now, next step is very important. Try to push your mind in a sleepy state. Actually, sitting straight, you have to fall asleep. So let your mind slip into a sleepy state. Keep your posture straight, balance your breath. Let your mind slip into a sleepy state. Keep breathing deeply, slowly. Not fast breathing. Breathe in 2 to 3 seconds, then breathe out slowly in 6 to 8 seconds. The longer you take to breathe out, the more relaxed you become. Breathing out is the key to relaxation. If you have trouble in breathing out for a long time, you can mentally create a humming sound. Whenever we hum or chant or speak, we are breathing out. Everybody can breathe out slowly. You just have to do it consciously. Breathe in deeply, breathe out slowly. Let your mind slip into a sleepy state. Most important prerequisite is there, don't move your neck, don't rest your head, sit straight. Those who have come just now, sit straight. Don't lean back. Leaning back, you will spoil all the benefit. Yogic relaxation has more effect than sleeping. Sleeping for 10 minutes will not give you any relaxation. But if you do yogic relaxation for 10 minutes, it will give you benefit of half an hour, 1 hour of power nap. Start focusing from the toes. Focus on your toes. Contract your toes and relax it. Make your toes stiff and relax. You are not making any movement, just making the muscle stiff and relaxed. Pure isometric movement. Just stiffening the muscle and relaxing it. Move from the toes to the ankle. All the muscles of foot, make them stiff and relaxed. Stiff and relaxed. Stiff and relaxed. Now this has to be synchronized with the breathing. As you breathe in, make the muscle stiff. As you breathe out, relax them slowly. Breathe in, make the muscle stiff. Breathing out, relax them slowly. Move on to your calf muscles. All the muscles of leg. Do the same. Breathing in, make them stiff. Breathing out, relax them. Breathing in, make them stiff. Breathing out, relax them. Breathing in, make the muscles of your leg stiff. Breathing out, relax them. Once more, breathing in, make the muscles of your legs stiff. Breathing out, relax them. Now move your concentration to the muscles of thighs. You do on your own for 5 breaths. Each time you breathe in, stiffen your thigh muscles. Each time you breathe out, relax them slowly. It takes 10 minutes, 10 seconds for one breath. Make them stiff for 2 to 3 seconds, then slowly relax them for 6 to 8 seconds. So, on each muscles, you have to spend 1 minute. Move on to the muscles of your pelvic region. Contract your anus upward. Whole the perineum should be contracted up. Same way, each time you breathe in, contract it. Each time you breathe out, relax. Each time you breathe in, contract. Each time you breathe out, relax. Contract for 2 to 3 seconds. Relax for 6 to 8 seconds. Straighten your posture. You can do this whole relaxation only if your posture is straight. Otherwise you fall asleep and you will lose all the benefit. Now move up the muscles of abdomen. Whenever you breathe out, you are contracting your abdomen. Okay? Breathing out, contracting your abdomen. Breathing in, you are raising your chest, holding the abdomen, navel, wherever they are. 5 breaths. Contract your abdomen for 6 to 8 seconds while breathing out. Raise your chest for 2 to 3 seconds while breathing in. Now focus on your face. Do the same thing. Squeeze all the facial muscles. Tighten your lips, tighten your eyes for 2 seconds while breathing in, and relax them slowly for next 6 to 8 seconds. Contract them for 2 seconds, relax them for 6 to 8 seconds. So once you are learned, we have learnt about it, it will take maximum 10 minutes for this whole process. If you practice this 10 minutes post lunch, you will not feel sleepy in any lecture. So now slowly open your eyes and relax. Okay. Now we'll commence our next session. Please switch on all the lights. Thank you. Sir.
So good afternoon.
It was a new thing we have learned. For this session, I would like to invite our next speaker, none other than our beloved Professor Dr. Kunal sir. I introduce him. He is professor in the Department of Physiology, MGM Medical College, Kishanganj. And has been a resource person to more than 25 international and national CMEs, webinars, guest lectures, workshops, etc. He has 30 years of experience of learning and practicing yoga and has been teaching yoga and physiology for 15 years. He has conducted numerous research investigating the impacts of different yoga practices, presented his findings in various national and international conferences, published many original research articles in reputed journals of high impact, and received Best Paper Award in multiple conferences. So please come on the stage. I would request a first year student, Astha, please guide sir to the stage. To chair this session, I would like to call upon stage Professor Dr. Prithvish Bhattacharya sir from the Department of Anesthesiology, Mata Gujri Memorial Medical College, Kishanganj. First year student, Himani Singh, please guide sir on the stage. Okay. Leave it. So, Kunal sir, please, we are eager to listen you.
আরেকটা স্যার ওইদিকে স্যার চার্জ नहीं लगेगा ना सर
Hello, am I audible? Last row, am I audible? Okay. Thank you, Dr. Arup and Dr. Payal. Thank you, sir. Good afternoon to all the delegates. Good afternoon, sir, dignitaries of the dais. My second session is going to be a little different. It is going to be more fast-paced and less of fact about the science. I'm just going through a glance through the references, impact of specific yoga practices on specific diseases. There might be a little bit of bump in the surprise if you're waiting to listen different yoga practices. You may not be interested at the end of the yoga session, at the end of my session. These are the agenda I'm going to cover today: a literature review of meta-analysis and systematic reviews of randomized control trial mostly, and other research work also, but they will be in this category. Principle of yogic healing, protocol for innate healing, specific yoga practices in specific diseases, a review. Okay, now you see this is the evidence pyramid. In research, we value this pyramid a lot. And the top of the pyramid is meta-analysis. Second best is systematic review. Then we have critics, very acclaimed critical reviews. Then we have randomized control trial. So if any research work falls into the top 4 categories, they are the best research work and they can be trusted. Especially the top one can be trusted because they are meta-analysis of all the published papers, many published papers on the same topic. Okay, so let us see what I got when I searched about yoga. Stress reduction and health benefit. All these papers have very positive things to say about the effect of yoga, and those things will be repetitive if I repeat it again. So I'm just giving you examples. This meta-analysis published in Psychosomatic Research Journal, cited by 7,304 publications. Kramer et al., Yoga for Low Back Pain, 581 citation. Kramer, again, 885 citations, Yoga for Depression. Just keep in the mind, Yoga for stress, Yoga for low back pain, Yoga for depression. They are analysis of many papers, hundreds of papers. Yoga for anxiety, yoga on cardiovascular disease risk factors, yoga for breast cancer patient and survivor, safety during yoga. What happens if, is there any side effect? Did anybody ever died practicing yoga? None. Effect of yoga interventions on pain and associated disability. Means effect of yoga on pain. Psychosomatic health, psychological health, quality of life, physical health, and patient with cancer. Okay. Older adults, quality of life and functioning of physical functioning in older adults. Psychiatric disorder, treatment for major psychiatric disorders. Physical and psychological benefits of yoga in cancer patients and survivors, similar to the previous paper. Yoga for hypertension. Yoga for cognition, thinking, prefrontal lobe. Benefits of yoga in stroke, multiple sclerosis, and children to inform practice for children with cerebral palsy. Efficacy of yoga in training in chronic obstructive pulmonary diseases patient. Now medical science or meditation, because what I told you, yoga means meditation. If you just do meditation, don't do anything else, you are practicing yoga. But if you do lots of asana, don't do meditation, you are not practicing yoga. So again, you see all the good neuroimage and World Journal of Radiology, the publications and citations are good enough. Social and cognitive journal. Here you have Brain and Research Journal Elsevier. All have very good publication and very good citations. These are all high level published. You can believe their findings, not any goof of research work. Okay. So likewise there are many, and so let us see this yoga for asthma. What did they find in asthma? Very, very important. Okay. There was statistically significant increase in the dose of histamine needed to provoke a 20% reduction in FEV1. You see this response, what I told you, the body stops responding fast. Histamine needed to provoke asthma, there was 20% reduction, increase in the dose of same amount of histamine will 20% less decrease the FEV1. Okay. This amygdala and all I spoke in the morning. So these are the publications through which I have taken the finding. See the number of citation 2,274. And most of these are like a few years back I have compiled them. So things would have been changed by now. What does yogic science say? Just I made you do something, simply sitting straight, watching the breath and thoughts. It is the most powerful core of yoga sadhana therapy. Okay? You must sit straight, practice of sitting straight. You think that you are relaxing your back by leaning back, but it's actually you are not doing good for your system. That relaxation is not, until you have a back pain, until you are a patient, you are not allowed to take support in the back. And if you are taking the support, taking your back, supporting your back, you will become patient today or tomorrow. It is guaranteed. Use it or lose it. You have got a system to keep it straight. If you don't maintain your straight posture, you are going to lose that system in due course of time. Biology, everywhere this principle is followed. If you don't use something, you lose it. How many of you need a chair or stool to wear your shoe and socks? Raise your hand. How many of you need? You need to feel like sitting, right? You're feeling shy in telling. Don't ever, even if you become 50, 60, never ever lose this habit. Thankfully, I did not see any hand coming straight. Some hesitant hands were there. But if you are able to wear your socks standing today, continue that practice. Never ever sit on the chair until you are damaged, until you are injured. Even when you are 70, you can stand up, bend down and wear your socks. That is the one criteria of physical fitness. We lose that ability only because we stop using that power. Okay? So, what did we do in last 10 minutes? We experienced the body, mind and soul. Now you see here it's a very, very interesting thing. Body, mind and soul. Are there three separate entities? We know body, we know mind, but where is the soul? Do we have a soul? Yes? What is the proof that we have a soul? So, yogic system, they had logics to prove it. It's like you have eyes, and eyes can see something. So, drashta, drishya, और देखने की शक्ति, ये तीन entity है. You know, the seen, the seer, and the ability to see. The instrument to see are three separate things. The instrument to see, the camera cannot take its own picture. Eyes cannot see itself. Likewise, your mind cannot see itself. If there is someone to watch over your mind, you see, mind is thinking. The same mind is thinking, then who is watching that thought? Okay, that's how they say soul is there, soul is the watcher, soul is the seer. So when the people become realized, they are called seers, drashta. Drashta se darshanik banta hai. So that is how they prove existence of soul. And all of you experienced it. You were watching your thoughts. And because you are watching it, that watcher is separate. If you are stuck in a traffic, you cannot see yourself from the top that kya traffic ka position hai. Right? You must be away from the traffic. You must be having a drone camera to see yourself. That drone camera is the soul. Okay? But we are not using that ability. We are not watching ourselves. So again, soul is taking a side. We are not losing that capacity, connection with the soul. So creating that connection is yoga. Yoga means union. Union of the body, mind and soul. All three gets united, they work in harmony, and that is the purpose of yoga. Okay? So medical science explains benefits of yoga. They can't explain how this happens in most of the cases, okay? Especially when it comes to meditation and all. Okay. Yoga says that it works on the principle of Panch Kosha and Panch Prana. Okay? It purifies the Panch Kosha and strengthens the Panch Prana. And that thus facilitates healing at the desired place. Medically proven that I told you what all it does medically. So let's see more in detail. Dhyana, I thought of starting and then teaching this, but we already watched the breath. We were doing the breathing, mind was doing the thinking, and soul was observing. And this harmony was created with the prana. You were watching your breath. So that this is what is the circle triangle of meditation, and this is the goal of yoga, to create harmony, to unite the body, mind and soul. Meditation brings the harmony. Okay. Yoga works on, so Panchakosha, Panchaprana, let's look this Vedic causation of principle of disease. What Veda explains, what yoga explains. Now, this word comes Vedic and Upanishad and all, because you may not be aware, our life system was yoga. There are 108 known Upanishads, and out of which 54 are dedicated to yoga. Out of 54, 20 are for all the practices, all kinds of practices. They just explain everything, asana, pranayama, and remaining another 24 are talking only about meditation. Okay? So 54 of 108 known Upanishad are talking about yoga. But none of us have studied. Some plundering happens that the gurus who were teaching us, they were all destroyed. So our forefathers, they grew by themselves. So they only had faint memory of their ancestors. And slowly it got completely lost in due course of time. But now how it's coming back, I'm telling all these things not because somebody taught me or trained me. I taught myself. And how it happens, I'll tell you. So the story goes of Panchaprana, that Bhrigu asked his father Varuna. Very, very interesting story. You will be surprised to see how parents were treating their kids those times. Okay, his father Varuna was a great rishi. Bhrigu asked that what is the most fundamental element which moves this whole universe? Instead of giving a direct answer, Maharshi Varuna hints at his son to perform tapas, okay, and find the answer on his own. Bhrigu does the tapas, and first he realizes that, okay, body is everything, and body is made up of food. Whatever food we eat, there's some an or some man. So an is everything. He comes and tells that the whole Brahmand is made up of anna. If you don't eat, you will be perished. Then Maharshi Varuna says to Maharshi Bhrigu, who was still a son, like a small toddler, like around 10, 11 years old. You are on the right path, go do more tapas. Tapas means dhyana, sadhana. And after a few months or days, again he realizes, no, it's not it is the mind which moves everything. Now, this is the classical difference between the present medical science and old medical science. Present medical science says that healthy mind lives in a healthy body, right? But our ancient medical science says that it is the healthy mind which makes the healthy body. Okay? Mana affects annamaya. So they call annamaya kosha. The kosha, that body which is made up of anna, that is being affected by manomaya kosha, your mind. Your mind is superior to your body. Now here comes the concept of epigenetics. Sir was talking. 95% of the cancers and 95% of disease, although they are genetically linked, they are not because of genes. They are not inherited. We have capacity to stimulate or suppress the genes in our body. And according to yogic philosophy, they say that your mind, your thinking has capacity to stimulate or suppress a gene in your body. You can do genetic change by your desire. You can do epigenetics as you desire. So this is the concept of manomaya kosha. Then after further tapas and all, he realizes that it's not mind. Mind is not disturbed. There is someone else who disturbs the mind. And what is there to disturb the mind? Vijnana, Vishesha Jnana. Now again, Western philosophy says ignorance is bliss. Our Veda says Ajnana hi andhakar hai. Okay? Ajnanta is darkness. It is the ignorance which creates all the problem. So, Vijnanamaya kosha, when you are not able to connect the dots properly, when you are not able to get the inference proper conclusion, your decision goes wrong, your conclusion goes wrong, and then your mind gets disturbed. So, mind affects your breath, mind affects your body, right? But what affects your mind is your decision-making ability, is the ability to acquire the knowledge. How much ever knowledge you have, whether you are using them properly to get a right conclusion. That is called Vijnana, Vishesha Jnana. So Vijnanamaya kosha is superior. Then further they realize that, this the same Maharshi Bhrigu realizes that, even this Vijnanamaya is not enough. There is something else which affects your ability to get the proper conclusion. And that is Ananda, Anandamaya, the happy state of mind. First thing what happens, something makes you sad. When you are not happy, whatever is happening around, if you are not happy with it, you are not properly oriented. And then whatever conclusion you draw, it's not a proper, you are not using all the information to the best of ability. And then everything happens. The first thing gets destroyed is Ananda. And that's why you see all the rishis and those jnani, they put their name Nityananda, Sadananda, Chidananda, everybody writes Ananda. Because Ananda is the most important thing. You should be happy. First requirement is be happy. But then how to be happy when we are forced to sit here in the post-lunch session with a threat that attendance will be cancelled? How to sit here? Okay? For that, you should be indifferent. For that, whole yoga came. That if you practice yoga, your amygdala will be slowly working less, and you will become indifferent to the surrounding, and then it will not be able to disturb your state of ananda. You will remain happy because nothing is bothering you. Okay. So this whole yogic principle is about healing this panchakosha. Okay. That's how, and in this panchakosha, there is another shloka in Gita, okay, Bhagavad Gita. It says that Shreyo hi jnanam abhyasat, jnanat dhyanam vishishyate, dhyanat karmafala tyaga, tyaga shanti anantaram. Matlab, knowledge is better than practice. Now you see, all the religious people, those who call themselves spiritual, only thing they are doing is practice. They go to a temple, they chant some mantra, and as a kid, you always have question. You never were convinced with their effort, but you were forced to follow some religious practice, right? What they are doing is practice. What is better than practice is knowledge. When you asked, why are you doing this? They don't have answer, why are they doing it? If you know why are you doing something, that is better. Then the things will be more effective. Why I am saying all these things? When you know how yoga works, and with that mindset, with that panchkosha knowledge, if you accept yoga and practice yoga, it will be more effective. Why? Because Shreyo hi jnanam abhyasat. Knowledge is better than practice. Jnanat dhyanam vishishyate. Better than knowledge is meditation. I gave you example of Newton, Archimedes. From where they got all the knowledge? They did not have to read a book to understand gravitation or density, how to measure density, right? They discovered. Einstein got relativity from where? Till now, people have not understood. Now, a few years back, they used one formula of relativity and they proved the existence of black hole. And they told that if the Einstein was alive, he would have got 10 Nobel Prize. Because after his death, he himself was not convinced with the relativity, but he got this idea. And the same goes for every discovery. You know Ramanujacharya? Ramanujan? YouTube में movie है, देख लेना जा करके. He died at the age of 37 with tuberculosis. And at the age of 32 or something, he was clerk in one of the railway office in. He failed in all his exams. He was fanatic of mathematics. He used to sit in the temple and write so many theorems. Then one British saw, because he was working in British office, they took him. And finally he was, sorry. He was put there in Cambridge. And in Cambridge, with tuberculosis and all, he went on writing thousands of pages. They preserved it. Still they are trying to prove it. Recently they proved one of his, still they have not understood it completely. You go and find out, read about Ramanujan. I am not exaggerating any fact. They have not understood all the Ramanujan's theorem completely. They are trying to understand. A few years back, maybe this year only, if I may recall correctly, they proved one of his theorem right, and that is helping them to correct the path of some satellite which was not going right. Okay, so knowledge is there all around. Dhyanat dhyanam vishishyate. Meditation is, so whatever you read, you should meditate more on whatever you are reading. Then you will get inferential knowledge. Okay, but best thing is work, just work as a duty. You are born and you will die someday. In between time, you have to spend somehow. So whatever you are doing, do it for the right cause. Because this seems right, this has come into my lap, I'll do it wholeheartedly. That is the mantra for happiness. Tyaga Shanti Anantaram. Immediate peace will fall because of Tyaga. Again, this has been misunderstood that we should not think about the fruit. Karmanyavadikaraste ma phaleshu kadachana. No, you should not. It's not like that. You should work because work is there. Fruit will come. It's not that you should work without thinking about the result. ये पागलपन नहीं है. ये है कि do your work seriously. Don't think about the result. Result will come. It will come. It is not going to. When the hands come together, it will create sound. There is no way the sound will not come. Right? So, these are the different level. Ananda comes after karma phala tyaga. After ignoring things around, Ananda will come. So let us understand point by point yogic principle of disease causation. Okay. Disease happens when we lose calm. Okay. Loss of bliss. First, the subtlest Anandamaya kosha is disturbed. Then the kosha get affected one by one. Okay. Thus, healing or purification of Anandamaya kosha shall always start first. Okay. And Anandamaya kosha will be healed, purified only by selfless act, self-surrender, reflection. Okay. Vijnanamaya kosha by self-study, inferential knowledge. Manomaya and Pranamaya by awareness of thoughts and breath. Okay. This is the sequence. First, Anandamaya by selfless. There are many examples. I don't have time. I read about Rockefeller Foundation. Okay. Mr. Rockefeller was the richest man in America. Okay. And at the age of around 50, he was told that he will have only 6 months to live because he had some terminal sickness. And he owned 25% of the American economy. So what did he do? He sold most of his oil wells and he created chain of free hospitals in 6 months. And after 6 months, when he went for checkup again, that when he is going to die, doctor found that his sickness disappeared. Okay, after 6 months, his sickness disappeared. Like this, many examples are there. Selfless act, self-surrender, reflection. Keep thinking what's going on and how can I make it better. Just think, whatever bygone is bygone. You just have to think, how can I make it better? That is called reflection. What went wrong and how can you make it better? Okay. And Anna means healthy environment, food and lifestyle. So this is the Example I give you here. Causation principle lies in the mind. Okay, many people complain of back pain. Okay, most of the back pain or most of the muscle pain, most of the pain in the body is because of excessive contraction of muscle, increased muscle tone, and we have two centers in the medulla. One is in the brainstem, pons and medulla, reticular formation. They control our muscle tone. Pontine is excitatory and medullary is inhibitory. What is the problem here? Excitatory center is automatic. It goes on stimulating the muscles, keep on increasing the muscle tone, because we should not be conscious to maintain our posture. It should be subconsciously maintained. Then only we are free. But to inhibit a muscle, it has to be a conscious effort. Medullary center, next slide comes for that. First of all, only so representation, so less in the brain, very less neurons are there to control your whole trunk, and that too, their inhibition is under cortical control. Okay. Now what happened? I was asking you to stiffen it and relax it. Consciously go on relaxing for 6 to 8 seconds. Only when you consciously relax a muscle, it will relax. If you are suffering with any musculoskeletal pain, the problem is with relaxation, complete relaxation. Problem is increased muscle tone, stiffness. Okay? And conscious relaxation. Your brain is very powerful. Consciously you send impulse to medulla, consciously you relax the muscle, it will relax. And in due course of time, whatever stiffness is there, it will come down slowly, slowly. So this is how Vedic people explained mind is the cause of most of the disease, and mind can be controlled by cortex, our conscious thinking. We forget to utilize our conscious effort when we are under stress, and this resetting is done by yoga. Now what is this resetting? Again, I give you example. Our computer or mobile gets virus and it gets spoiled. What do? The best treatment is do the factory setting. We get sick because our brain is working haphazardly. Okay. Brain is not sick. I tell you, example is, see, your hypothalamus is working very correct, very effortfully, physiologically. Why? Because your glucose level is high, because hypothalamus is maintaining that level. You take a medicine, it goes down as long as medicine is effective. When the effect is gone, hypothalamus brings it back. That means hypothalamus is very much aware, I have to bring it back to normal. Only thing is, in the due course of time, you have confused your hypothalamus because you were continuously under the stress and your cortisol was keeping the level high. So hypothalamus got confused and it felt that, oh, this high level is normal level. I have to maintain this level. Your glucose, all the drugs are not working on hypothalamus. They are working on the peripheral receptors and glucose and wherever. What will work in hypothalamus? Only yoga will work on hypothalamus. When you practice yoga, when you practice meditation, yoga nidra, relaxation, slowly, slowly this resetting happens and the disease disappeared. Okay? There is another concept. I will skip this. I will just tell you the gist of it. Okay. It is called Panch Prana. After Pancha Kosha, this is Panch Prana, one of the only Pranamaya Kosha. Because prana is most important. There are 5 kinds of prana, they say. The one which goes down is called apana. The one which moves up is called udana. Up, upar, udana. Okay, यहाँ से ऊपर. बीच में जो हार्ट में रहता है उसको प्राणा बोलते हैं, और जो सर्वव्यापी है उसको व्याना बोलते हैं. Easy to remember. Apana, udana, here, prana, and जो चारों तरफ है circulation में व्याना. Now different pranayama practice are there to strengthen different of these prana. Depending upon which region has the problem, a good yoga therapist will analyze that and will give you that kind of pranayama practice to strengthen that prana. Okay? So yogic therapy is based on the principle of Pancha Kosha and Panch Prana. Panch Prana helps in this resetting. Antar Kumbhaka, Bahir Kumbhaka, these are the types. Pranayama, what you did right now is called Ujjayi Pranayama, slow and controlled breathing. Little bit more is there for Ujjayi. If you contract your abdomen and breathe, that is called Uddiyana Bandha. If you contract your perineum, anal region and breathe, that is called Moola Bandha. To strengthen different. You fix your chin to the chest and then keep breathing normally. That is called Jalandhar Bandha. That is for Udana Vayu. And this is where prana work and this is where yoga work. You see this Jal, 96,000 nadis, they say 93, 92, whatever. That is where pranayama works. And this is where all this. So what I call, this is my own word, you won't find it anywhere, innate healing. Okay? Yoga sets your system back to the way you were born with. Innate. जो तुम्हारा innate ability था, you get it back with the regular practice of yoga. How? Because yoga purifies Panch Kosha and Panch Prana and reset the system back to its innate ability, and thus a complete cure. You search the literature so many times, thousands of times, diseases have disappeared. Hypertension, diabetes, they just disappear. Many of the yoga therapists, those who are prescribing both allopathic as well as yogic therapy, they say that most of my patients stop coming to me. Then after a few years, I go to their house to follow. Why are you not coming? So वो मैंने ग्लूकोज चेक किया था, दवा लेता नहीं हूँ, मेरा ग्लूकोज कभी ऊपर जाता नहीं, इसलिए मैं आता नहीं हूँ. मैं रेगुलर योगा प्रैक्टिस कर रहा हूँ. This is the story of a common diabetic person who regularly have gone to an yoga therapist. Hypertension का भी same story है. You won't believe. पहले मैं सुनता था रामदेव बाबा का इतना क्लेम ऐसा है वैसा है, ये हो जाएगा वो हो जाएगा. I was as skeptic as any doctor. But when I realized, when I studied and when I saw patient by myself that ये knee pain, back pain, diabetes, hypertension, migraine एकदम disappear हो जाता, आता ही नहीं है. बस डेली आधे घंटे का योगा प्रैक्टिस करते रहना है, बीमारियां एकदम दूर रहती हैं. Because complete cure is possible. हाँ, लेकिन अगर प्रैक्टिस छोड़ दिया 2-3 महीने में वापस relapse हो जाता है. So there are so many ways to purify this Panch Kosha. Okay. We are running short of time, so I will skip this. So based on this whole purification principle, this is my own protocol. Okay. This is how I give yoga therapy. I start with Anandamaya, end with Anandamaya. In between I move to Vijnanamaya, Pranamaya, Manomaya, Annamaya. Spend more time with the Annamaya, that means body and Prana and Manomaya. And then again end with in the same way. So if you want to know different yoga practices for different disease, this is why it does not matter. Now you realize I have the whole set for different disease, different yoga practice, but you will realize that it is more or less the same yoga practice. There is hardly any difference. Only those who are expert, they will realize some differences are there, and those expert will tell you this 1-2 things are different, but they tell this is for diabetes. ऐसा नहीं कि सिर्फ उतना ही करना है. One specific thing is more effective, but the whole package has to be practiced. You see, you try reading these names, okay? I will show this, just show the slides of different. You see, Jalaneti, Sutraneti, Kapalabhati, Talasana, Kati Chakrasana, Urdhva, Hastotanasana, Pavan Muktasana, Sarvangasana, Saral Matsyasana, okay? Ushtrasana, Sashankasana, Paschimotanasana, Makarasana, Vakrasana, and Pranayama is Ujjayi, Sitkari, Brahmari, and meditation. And here you have Nadi Sodhan, that is Anulom Vilom. Shavasana is there. Now look at the different one. Arthritis के लिए क्या है? कुंजल क्रिया, that is vomiting, एक ये different है. Kapalbhati is there, Tadasana, Kati Chakrasana, सब कुछ Shavasana, Makarasana, Nadi Shodhan Pranayama, meditation, okay, Dhanurasana, most of them are same, okay. Pavan Muktasana, okay, bronchial asthma के लिए क्या है? तो full yogic breathing. What you are doing is called yogic breathing. Nadi Shodhan Pranayama, Surya Nadi Pranayama, Brahmari Bhasrika. Like for every disease you have nearly same set. One, ek do alag hai. And that makes some difference. So, abhi hypertension ke liye. So, likewise all the disease packages are there. If you go, why I showed you that if your yoga therapist gives you the same package for every disease, don't be skeptical. क्योंकि एक ही बीमारी सब बीमारी के लिए एक ही दवाई कैसे होगा, है ना? So this is very very unbelievable for a doctor. क्योंकि हम तो हर बीमारी के लिए अलग अलग दवा लिखते हैं. योगा वाले सारी बीमारी के लिए एक ही दवा लिखते हैं. Because yoga does not work on बीमारी as such. It works on your mind. It cleans you from within. और disease अपने आप गायब हो जाता है. क्योंकि इनका प्रिंसिपल है कि everything is because of resetting. बहुत सारे immunity वगैरह बढ़ जाती है, सब कुछ हो जाता है, अपने आप disease गायब हो जाता है. Okay? So this is what I did not finish in the morning. It's very very important. Ashtanga yoga for a complete healing. So everybody must practice Ashtanga yoga if you want a complete cure with the help of yoga. Ashtanga yoga को मैंने 4 भाग में divide किया है. 2 8. Ashtanga means 8 limbs. So 2 into each step. One step will bring harmony between physical, mental and social well-being. Second step will bring health, physical and mental health. Third step onwards, it starts concentration, it works on the mind, focus, increase focus. And fourth step is true knowledge and permanent bliss. Okay. So what is the first step? Yama. What is yama? Principles to follow at any cost, or ahimsa, satyaste, brahmacharya, aparigraha, yama, or just non-violent truth, honesty. It's like follow some principle. Don't be unprincipled. जो मन किया जब मन किया वैसा मत करो. अंदर का सिस्टम डिस्टर्ब हो जाता है. You make your principle and follow it. Following, adhering to the principle is very very important. That is called yama. Second is niyama. Now this is the discipline. There is a difference between principle and discipline. Means daily life. डेली लाइफ में तुम्हारा डिसिप्लिन है कि नहीं? क्या डिसिप्लिन है? शौच, संतोष, तपः, स्वाध्याय, ईश्वर प्रणिधानानि. Purity, contentment, austerity, self-study, and surrender to God. Okay? This surrender brings. Can you tell me what happens? We surrender ourselves to the God. How do we get cure? How it is important for healing? Anyone? किसी को समझ में आया? It purifies our Anandamaya Kosha, the top. That happens only by surrender or selfless service. So surrendering is very very important. Asana and pranayama is for normal health, bodily health. Just by practicing asana and pranayama you get healed, but you will not be completely cured. Okay? But any disease will be reduced by the practice of asana and pranayama. Pratyahara. Again, this looks like a very complicated thing. I give you example. What is pratyahara? They say that withdrawing your senses from their subjects of sensation. How it is possible? कानें खुली हैं तो सुनाई तो पड़ेगा ना. How to withdraw the ear? अभी हर किसी को एक्सपीरियंस होगा प्रत्याहारा का. ऐसा कभी हुआ है कि किसी ने तुम्हारे मित्र ने या माता पिता ने तुम्हें आवाज दी और तुम्हें सुनाई नहीं पड़ा? Everybody would, people are calling. कोई सामने से गुजर गया तुम्हें दिखाई नहीं पड़ा? If somebody asks you, did somebody pass by? Oh no, I don't know. Were your eyes closed? No, my eyes were open. So where was the eye that time? Where was the ear that time? You were lost in thoughts. उसको प्रत्याहारा कहते हैं. You were focused somewhere. वो automatically आता है. Inner calling से आता है. Inner desire से आता है. Whenever you are lost into anything, automatically pratyahara आएगा. So if your eyes and ears are disturbing you, it is not that external things which are disturbing you. It is your internal. Internally you have to channelize your energy. Be focused, more and more focused. The way, especially आजकल तो सबके साथ होता होगा, सब मोबाइल में लगे रहते हैं, है ना? कोई बुला रहा है सुनाई नहीं पड़ता है तो ईयर का प्रत्याहार, कितना भी गर्मी है कुछ देर के बाद जब बहुत ठंड लगने लगती है तब मालूम पड़ता है, बहुत गर्मी लगने लगती है तब मालूम पड़ता है. तो प्रत्याहारा इज नॉट सम डिफिकल्ट थिंग, इट इज अचीवेबल एंड एवरीबडी अचीव्स इट. देन धारणा का बताया, देशबंद चित्त से धारणा, ध्यान एंड समाधि का बता दिया था उस समय. तो ये पूरा 8 प्रैक्टिस करने पर कंप्लीट हेल्थ आता है और it remains there. Okay, so this is my message. If you listen to your body when it whispers, you won't have to hear it scream. Okay, with this, thank you for listening. Ask me if you have any questions.
Thank you, sir. That was an eye-opener for many of us.
Yeah.
Now I would like to ask the audience, do you have any questions? Any questions from the audience? I hope there is no question.
Sir has a question. एक इधर, हेलो बॉस, माइक देना सर को. सर.
Thank you, that was very wonderful. You mentioned pratyahara.
Yes, sir.
I think all of us, when we were reading stories, books, we were immersed in, and as he told you, we didn't hear anybody, all the sound around us disappeared. And that is, that immersive experience
Yes.
is wonderful.
Yes, sir.
And contributes to healing. So,
Yes.
what does immersion into the mobile contribute to healing?
No, sir. I told that immersive experience should happen when you are thoughtless. First, you have to close your eyes, sit with that posture, and you are watching your thought, and it's a higher state of dhyana that automatically you stop receiving things around, and you are lost somewhere.
While I said with levity the mobile, but when one is immersed in a book, in a story, it is a very constructive effort that is going on at that time. That immersive experience, it should have a positive influence on the
Yes,
body.
sir. Yeah, I was talking in
mobiles
the.
have a problem
Yes.
that they stimulate with light and these things, motion. But when we read and the mind is immersed in it, I think that should have a healing property which should
Yes,
help
sir.
us in
I was
coping.
talking in the morning the concentric and eccentric hypertrophy of the brain. If you are immersed in one particular thing, that area of the brain grows, and brain is happy. Whenever you are immersed something, that time brain is happy. That's why you are not able to leave the mobile, because you get happiness from there. But there are two kinds of happiness. It will go into detail. One is dopaminergic happiness. Other one is serotonergic happiness. Dopaminergic happiness is addictive, and dopamine has negative effect. It has got lots of negative receptors all across the brain. So whenever dopamine is high, it inhibits many areas of the brain, and it stimulates all other areas of the brain. So brain does not like it. Our biology does not like it. They start decreasing the receptors of dopamine. So dopamine का receptor का down regulation होता है. Every day you need higher dose of dopamine to feel the same kind of happiness. लेकिन serotonin के साथ ऐसा नहीं होता है. When you are, so as I told, when you are reading a story, when you are lost in a story, वो serotonergic happiness है. When you are talking to your friends, ये serotonergic happiness है. वो तुमको craving create नहीं करता है, but you are equally happy, and this serotonin has positive effect all across the brain. It stimulates your brain, and it does not have inhibitory effect in the brain. It prepares your brain to focus on different things. तो वहाँ से तो ये health
Thank
and
you very
happiness
much.
आता है, sir.
Actually, that is why I raised this point, because
Yes.
otherwise it becomes a term. It becomes a term which we don't internalize. So I just mentioned mobile because somebody from the audience could have asked that same thing. So I asked the question before you asked it, so that you could get a clearer
sir.
picture. Thank you. So reading a book, etc., the positive things where the serotonergic effects are coming, those are more likely to help you, and you can search for similar things which are going to help you to get a more positive. That is why always they talk of a positive experience, a positive feedback.
Yes.
Something that encourages you, uplifts you, that is important. Thank you.
Yes. Here I give a small clue, you know. How will you know whether you are addicted and whether it was dopaminergic or serotonergic? If you miss something, oh, that was such a nice experience. You want to relive that experience, but you are not craving for it. It is not disturbing you, you are just missing it. And when you miss it, then also you feel good. You feel good about missing it. That is serotonergic. You talk about your family, your friends, social connection आता है अभी सर बात करेंगे social connection. वो पूरा serotonin है. But when you start craving something कि वो ना मिले तो बेचैनी होती है कि नहीं मुझे करना ही है. वो क्यों नहीं है? वो डोपामिनर्जिक है. वो बड़ा नुकसानदायक है. बड़ा नुकसानदायक है. एक रैट के साथ एक्सपेरिमेंट हुआ था. एक रैट को एक केज में डाल दिया गया और जो हमारा न्यूक्लियस एक्यूम्बेंस है, जो मेन डोपामिनर्जिक सोर्स है, वहाँ उसको एक इलेक्ट्रोड लगाया गया. एंड देन देयर वर प्लेंटी ऑफ लीवर्स टू प्रेस. ओके, इनिशियली रैट विल प्रेस वन लीवर. किसी से फ्रूट आएगा, किसी से अलग अलग टाइप का फूड आइटम आएगा. आफ्टर अ फ्यू डेज रैट डिस्कवर्ड दैट इस लीवर को प्रेस करने से वहाँ स्टिमुलेशन आता है. आफ्टर दैट डे that rat did not press any other liver. It went on pressing that liver till it died, because with hunger and starvation and everything. So pleasure, seeking pleasure leads to complete destruction, total annihilation of your existence. That is the yes.
You talked about specific therapy. So
Yes,
whenever we talk of therapy,
Yes, sir.
for every medicine nowadays, the question of circadian rhythm and the timing of a medicine has become relevant.
Yes.
So are there circadian rhythms for your yoga therapies at specific combinations or specific ones? In a
Sir, there are plenty of things. I just cut short so many. When it comes to circadian rhythm, yoga therapy works with the circadian rhythm. Let's just take example of early morning waking up, glucose. Okay, morning, night, midnight. If you are in deep sleep, if your stomach is empty, hypoglycemic, your growth hormone will be at peak. Growth hormone is a hyperglycemic hormone, and it is very very important for the repair of all your wear and tear. But उसका 3 requisite है. Midnight में deep sleep, empty stomach, hypoglycemic, and एक और क्या बोला? Okay, आ जाएगा. So this growth hormone starts coming up in your deep sleep. Suppose you sleep late में आएगा लेकिन वो peak को achieve नहीं करेगा. Morning में क्या cortisol आएगा? When you are waking up, cortisol comes in the picture. Again, it is going to raise your blood sugar. Okay, till 8 o'clock, cortisol is at proper level. So till 8 o'clock, nobody should eat anything, because you are in hyperglycemic condition. Your hormones are active to keep the glucose up. That's a good time to burn glucose. Do something, exercise. So all the yoga practices को सुबह सुबह करते हैं, क्योंकि yoga practices are mostly neuronal. और न्यूरॉन को सिर्फ ग्लूकोज चाहिए सर्वाइव करने के लिए. न्यूरॉन फैट नहीं बर्न करता, वो सिर्फ ग्लूकोज बर्न करता है. और फिर ड्यूरिंग डे टाइम यू हैव लॉट्स ऑफ स्ट्रेस हार्मोन कमिंग अप. बाय टाइम इट बिकम्स इवनिंग, यू हैव टू गेट बैक टू योर सर्कैडियन रिदम. तो इवनिंग में भी संध्या में कुछ मेडिटेशन का डाला गया है. योगा इज कम्प्लीटली अबाउट सर्कैडियन रिदम, एंड समहाउ they did not know the names of hormone, but they knew what's happening in the body at different time, and they have planned their activities like that. Yogic don't eat early, they don't eat late also. संध्या रात के पहले डिनर हो जाना चाहिए, तभी क्योंकि मिडनाइट में एम्प्टी स्टमक चाहिए, हाइपोग्लाइसीमिया चाहिए, तभी ग्रोथ हार्मोन पीक पर आएगा. अगर मिडनाइट में आपका हाइपरग्लाइसीमिक कंडीशन है, दैट विल सप्रेस द रिलीज ऑफ ग्रोथ हार्मोन. थोड़ा कम आएगा, उतना नहीं आएगा. फिर आपका वेयर एंड टेयर का रिपेयर कम होने लगेगा, फिर आपका अपने आप डिजीज हो जाएंगे. सो आवर लाइफ स्टाइल इज अ टिपिकल प्रिस्क्रिप्शन टू गेट सिक, एंड all those yoga therapy and all will trying to change it. Yes. Thank you, sir.
Okay, any more questions from the audience?
कोई देना?
सर हम लोग मेडिटेशन स्लीप पोस्चर में भी कर सकते हैं क्या?
स्लीप में योग निद्रा होता है लेकिन सोना नहीं है. आज जो मैंने कराया दैट इज कॉल्ड प्रोग्रेसिव रिलैक्सेशन. उसका बहुत इफेक्ट होता है ब्रेन पे. वो तुम सो करके भी कर सकते हो बट सोना नहीं है, क्योंकि सो गए तो फिर ये बॉडी ऑटोमेटिकली अपने उस रिदम में चला जाएगा, मसल टोन इंक्रीज करेगा, ब्रेन को एक्टिवेट करेगा. बिकॉज स्लीपिंग इज अ हाईली मेटाबॉलिकली एक्टिव स्टेट. यू नीड स्लीप टू ग्रो, टू डेवलप योर मेमोरी. सो योग निद्रा करना है लेकिन सोना नहीं है. कुछ ड्यूरेशन डाल दो, 10-15 मिनट के लिए योग निद्रा किए, देन यू गो टू स्लीप.
एंड सर मेडिटेशन एक्चुअल में है क्या? डीप स्लीप है या फिर सबकॉन्शियस स्टेट है?
बताया तो कि ये ना तो डीप स्लीप है ना ही सबकॉन्शियस, ये फुल्ली कॉन्शियस स्टेट है. यू आर अवेयर ऑफ थिंग्स. आइदर यू आर अवेयर एक्सटर्नली, उसको माइंडफुलनेस कहते हैं, और यू आर अवेयर इंटरनली, जब प्रत्याहार हो जाता है और उसको समाधि कहते हैं. दैट समथिंग विल जस्ट पॉप अप इन योर. जैसे जितने सारे साइंटिस्ट होते हैं दे आर इंटरनली अवेयर, दे आर लॉस्ट फ्रॉम आउटसाइड. सो 2 तरह का मेडिटेशन होता है, बाह्य और अंतर ध्यान या बाह्य वस्तु का. स्थूल ध्यान और सूक्ष्म ध्यान कहते हैं उसको. ओके, बट इट्स अ कंप्लीट अवेयर स्टेट. इट्स नीदर स्लीप नॉर सबकॉन्शियस.
Okay, one more question. That's it.
Sir, you mentioned a lot of ways of starting to practice the yoga and everything. So people who do not have any experience in this, how should they start it first of all? And second of all, suppose lots of things for our students, there are exams. For us, sometimes we are going out, so we are not able to maintain the thing. So once we start, suppose there is a break, then how to keep the consistency? Are there any tips, or how should we start?
Okay. Now here there are different school of thoughts. Some people say that बिना गुरु के ज्ञान नहीं होता. ठीक है. Another school of thought says that there is a concept of resonance. Have you heard of resonance? अभी ट्यूनिंग फॉक है ना, फिजियोलॉजी में एक्सपेरिमेंट करना. अलग अलग फ्रीक्वेंसी के ट्यूनिंग फॉक को रख दो, एंड देन बीच में यू टेक वन पर्टिकुलर फ्रीक्वेंसी ऑफ ट्यूनिंग फॉक एंड यू वाइब्रेट इट. The one tuning fork which has a similar frequency will start vibrating on its own. उसको रेजोनेंस कहते हैं. जब सेम फ्रीक्वेंसी है तो वाइब्रेशन एक्सचेंज हो जाता है, ट्रांसमिट हो जाता है. तो आई सजेस्ट पीपल, इफ यू डोंट हैव एक्सेस टू गो टू अ गुड गुरु टू लर्न योगा, यू स्टार्ट विथ मेडिटेशन. जब हम वो थॉटलेसनेस में जाते हैं तो जो हमारा जो फ्रीक्वेंसी डाउन होता है, देन वी स्टार्ट getting into that resonant, we start receiving thoughts. अभी क्या है ना कि एनर्जी कैन नेवर बी क्रिएटेड नॉट डिस्ट्रॉयड. जिन लोगों ने जो कुछ भी बोला है, देयर इज लॉट्स ऑफ वन क्वांटम कॉन्सेप्ट इज देयर. देयर इज अ 0 point in the space. Everything is trapped. Everything, all energy is there around. कैसे क्या है कि अभी रेडियो को ट्यून करते हैं तो एक गाना बजने लगता है. वो गाना किधर था? इधर ही है ना, रेडियो के चारों तरफ. जैसे ही उसका रिसीवर का फ्रीक्वेंसी मैच करता है, गाना बजने लगता है. हम लोग भी रिसीवर हैं. वी आर ऑल्सो वर्किंग ऑन फ्रीक्वेंसीज. जैसे ही हमारा फ्रीक्वेंसी किसी के साथ कैच होगा, वी स्टार्ट रिसीविंग इट. नाउ यू हैव स्टार्टेड अ बिग ये बड़ा सा चीज़ है. अभी क्या है, सपोज समबडी इज थिंकिंग अबाउट समथिंग बैड, स्टीलिंग, किलिंग, ईर्ष्या, द्वेष, क्रोध, मोह, नशा. तो उनका अगर थॉट्स उसी में है, दे विल स्टार्ट रिसीविंग ऑल अदर थॉट्स फ्रॉम अराउंड एंड दे विल ग्रो इन दैट फील्ड. राक्षस को ही वरदान मिलता है, देव को ही वरदान मिलता है. डिसाइड तुमको करना है कि तुम्हारे अंदर किस थॉट को ऊपर करना है, ऊपर लेकर के जाना है. इट्स ऑल देयर अराउंड यू, विल स्टार्ट रिसीविंग इट. सो वंस यू स्टार्ट मेडिटेटिंग ऑन वॉट एवर थिंग्स, दे से पावर ऑफ मैनिफेस्टेशन, सो मेनी कॉन्सेप्ट्स आर देयर. ओके, बट इट वर्क्स ऑन दैट प्रिंसिपल ऑफ रेजोनेंस. एंड इट्स वेरी वेरी. एक किताब है द अल्केमिस्ट, किसी ने पढ़ा है? शाहरुख खान की फेवरेट बुक है. उसने कॉपी किया उसका डायलॉग अपने मूवी में ओम शांति ओम में. क्या है? हाँ, जिस चीज़ को शिद्दत से चाहो उसे मिलाने के फिराक में पूरी कायनात लग जाती है. ये वही कॉन्सेप्ट है. अगर आप शिद्दत से चाह रहे हो, कुछ कर रहे हो, तो यू विल स्टार्ट रिसीविंग थिंग्स. अपने दिमाग में पॉपअप करेगा. आपको लगा कि आपका आइडिया है, लेकिन आपका होता नहीं है. आपके पहले हजारों लोग सोच के चले गए हैं और अभी हजारों लोग सोच रहे हैं उस आइडिया को. तो आइदर यू फाइंड अ गुरु और अत्त दीपा विहरत, अपना दीपक स्वयं जलाओ. ओके, थैंक यू.
Okay. Now I shall request our
the one the question he asked that
Yes, sir.
say he has practiced, then he is discontinuing, so then again he practices. So what will be the effect of this discontinuation?
Yes, sir.
Or and how to avoid this discontinuation? How
Yes.
to persistency to persistent to continue?
Yes, sir.
How to
तो
remain
दो
persistent?
चीज़ है सर. एक तो यहाँ बड़ा इंटरेस्टिंग है जो आपने क्वेश्चन किया, एग्जैक्टली सेम क्वेश्चन गीता में है जो अर्जुन ने श्री कृष्ण ने किया था. सेम क्वेश्चन कृष्ण भगवान गीता में, पता है वो 700 श्लोक की किताब है, उसमें योग शब्द का प्रयोग 100 से ज़्यादा बार हुआ है. मतलब पूरी किताब ही योग का मैनुअल है. तो अर्जुन कहते हैं कि आपने इतना सारा योग समझा दिया, मैं गृहस्थ आदमी हूँ, मैं कुछ दिन करूँगा, कुछ दिन के बाद नहीं करूँगा, फिर आई विल बी योग भ्रष्ट, फिर तो बड़ा में पाप लगेगा, बहुत नुकसान होगा. तब भगवान कृष्ण कहते हैं कि स्वल्पम अपि अप्यस्य त्रायतो महतो भयात, थोड़ा सा भी कर लिया तो ये आपको एक बड़ा सा बेनिफिट दे करके उधर ही रहेगा. फिर आप कितने साल तक भी नहीं करते हैं तो आपका पतन नहीं होता है. यू अटेन अ न्यू, ऊपर पे काम करता है ना, यू अटेन अ न्यू लेवल एंड यू एंजॉय द फ्रूट्स एट दैट लेवल, यू बिकम हायर अप. अभी क्या है कि कैसे कंटिन्यू करना है, तो उसके लिए महर्षि पतंजलि कहते हैं तन निरोध अभ्यास वैराग्य. अगर आपको पता लग रहा है कि आप डिस्टर्ब हो रहे हो, कोई बात नहीं. पहले तो यह है कि इफ़ यू आर डिसकंटिन्यूअस, नो प्रॉब्लम. सेकेंड थिंग इज यू कीप ट्राइंग टू बी continuous. If you keep trying to be disciplined and so, और वैराग्य मतलब why, what is the main reason of discontinuity, कि हमारा किसी चीज़ से मोह हो जाता है. We feel that ये अच्छा ये कर लेते हैं तो एक प्रैक्टिस छूट जाती है. So you have to keep everything away, focus. तो ये सब प्रैक्टिस करते करते ये आ जाता है, अभ्यास और वैराग्य से कंटिन्यूटी आ जाती है. Yes.
Okay, now I would request our respected chairperson, sir, to give his concluding remarks about the session. Sir.
सर हाँ, सर को माइक दे दीजिए ना.
Thank you for a very excellent
Thank you, sir.
dissertation. The most important thing I think you have stimulated in everybody is that they have to think for themselves.
Yes.
And one has to understand why one is immersing oneself into it, and it is not like a medicine. I give a paracetamol and the fever goes down. It has to be holistic. Expectations, whenever they are holistic, they will involve multifaceted approach as multiple asanas and the practices will be taken care of. So it is to stimulate in all of you the thought processes which you are free to use today, initiate today, continue or intermittently continue as you understood. But most important is to sow into your minds that yes, this is a possibility, this is a way. So how you can use it, to what extent you can use it, is for you to ultimately decide. So thank you very much.
Thank you, sir. Thank you, sir. अभी रहना है सर. और सर अभी कुछ.
Now I would request our respected chairperson, sir, to felicitate the speaker by giving mementos and certificate. like to call upon the stage Dr. Sharbari Shaha ma'am to give a token of gratitude to our chairperson.
Thank you, sir. Now, I would take my privilege to introduce the next speaker to you. The organizing chairman, sir, has required no introduction. Sir is Professor Dr. Malay Vikas Mandal, sir, MBBS, MD, PhD. He is now Professor and Head of the Department of Physiology, MGM Medical College, Kishanganj. Former UGC Senior Professor and HOD, Department of Physiology, IMS BHU, Varanasi. Has been teaching physiology for more than 40 years. Supervised several MD and 4 PhD theses. He has published more than 50 original research articles in paper-reviewed reputed journals. Recipient of various awards like Best Teacher Award by APPI, Most Popular Teacher by NMO, INSA, International Travel Fellowship, etc. He is also sectional editor of Beston Taylor's Physiological Basis of Medical Practice. I would request first prof student Himani Singh, please guide sir to the stage. To chair the session, I would like to introduce Professor Dr. Krishnadas Bhattacharya, sir, Head of the Department of Community Medicine, Mata Gujri Memorial Medical College, Kishanganj.
Interesting session on yoga and also some practice. So now I will be talking about a very new discipline of medicine, a branch which that is the lifestyle medicine. Though personally I have worked mainly on the experimental physiology using the animal model, but about this, because of this CME and experimental physiology is not much available yet here. So I tried to enter a bit in the new field and organized this CME. So it is all, I am also very new compared to the other speakers who are practicing the lifestyle medicine or the yoga or diet. In the morning we have heard about the diet, the role of diet. We have heard about the exercise. Diet, Dr. Gagan explained so nicely. First session was by Dr. Varun from VHU. He explained the role of the exercise and very elaborate way you have heard. So here I am trying to give you an introduction or glimpse of lifestyle medicine. So physiological basis of lifestyle medicine. Now why this is important, if you look at the scenario, the global scenario, the WHO, according to the World Health Organization, non-communicable diseases are responsible for 74% of the all deaths globally. Yeah, I think Dr. Gagan in the morning mentioned nearly 41 million deaths every year occurs, and these non-communicable diseases are actually mostly this lifestyle illness. So that is the distribution of the lifestyle illness in about 18% for cholesterol, hypercholesterolemia, the blood pressure, hypertension 24%, 17% diabetes, and 7% constitutes the thyroid diseases. And these lifestyle diseases have huge economic impact. So globally, the impact goes starting from the individual, then families, then communities, societies, and countries. That means global effect, and this is due to increased medical and non-medical expenses, loss of productivity, disability-related costs, household poverty comes because they are mostly spending the money on the food, on the drugs and other things, so food and healthy food procurement is reduced, so household poverty starts. So lifestyle diseases can negatively impact the country's economic growth, and WHO projects that the lifestyle disorders in India, it may cost 6 trillion by 2030. So that is the huge impact, economic impact that is creating by the lifestyle diseases. So because of this enormous increase, uncontrolled increase of the lifestyle diseases all over the world, the new branch, that is the lifestyle medicine, has come up. So it may not be very new to UK or in USA, but it is very new in India. As in the morning, Dr. Gagan also told about, and Dr. Gagan and Dr. Barun, they have formed a society in the line of this lifestyle medicine, and to improve or to reduce the lifestyle disease burden and improve the quality of life by teaching or making awareness, increasing awareness of this lifestyle medicine among the healthcare providers and population in general. So it is a very rapidly growing discipline. It focuses mainly on the lifestyle factors which have been discussed, very important factors already discussed in the morning, the factors like exercise, factors like diet, and the stress relaxation factors by yogic practices. Dr. Kunal just has spoken. So it is aimed to prevent, manage, and reverse the chronic disease. Yes, it is claimed, and in fact there are plenty of publications showing that it can even reverse. So primary aim is to prevent, and if there is something, how we can manage with the lifestyle, these physiological techniques and by alteration of the lifestyle, and how, if possible, some of this may be reversed even. And these are lifestyle medicine is based on 6 physiological pillars. So in fact, that those pillars have been also mentioned in the earlier lectures. So these pillars are to be looked into, and these pillars, if you can take care, you can prevent or manage and even reverse the diseases. So first pillar is a food, predominantly plant-based. We have heard a wonderful lecture from Dr. Gagan regarding this. Then second is the physical activity, exercise. It was also explained very elaborately by Dr. Varun. Restorative sleep, it has been the very sound sleep. It has been touched, so I'll be talking to some extent. Then stress management, which is mainly by the meditation and yoga. And avoidance of risky substances like tobacco, alcohol, and positive social connection. So these are the 6 pillars on which the lifestyle medicine is erected. So these pillars, some of the pillars already discussed, and some of them I will just highlight. So if you look the history of lifestyle medicine, it can be traced back to the ancient time. How? Say for example, the Hippocrates, during time, so some 400, 500 BC, he first narrated his work, freed medical practice from superstition and religion. So he narrated his works and focusing mainly the importance of diet. So he had written or documented the importance to the diet, exercise, rest, and well-being. That is the social connections. So almost you see here, there are 4 pillars he already described. So it is, in that sense, it is not very new. Then if you see the Confucius, of the Chinese philosopher, he also recognized that and advocated the moderation in diet and alcohol, and as well as the meditation and mindfulness. So he also touched these principles. And finally, it is Ernst Winder in 1980s. He was an epidemiologist, and he coined this concept of medicine while providing the link between smoking and lung cancer. So smoking and lung, he is a very renowned personality for proving the smoking and lung cancer link. So I think Professor Bhattacharya, Professor Krishnadas Bhattacharya sir will acknowledge this, that he is the pioneer in linking the smoking and tobacco and the lung cancer cause-effect relationship or their association. So then what we are talking about, is it an old wine in a new bottle? So the concept was there. So yes, it appears like that. But those concepts were not propagated properly. Somewhere we missed the link, and now we are trying to revive it again. So the concept were there, but we did not have adequate scientific evidences. Now we have enough scientific evidences. Dr. Kunal was showing in the morning the several meta-analysis and systematic reviews. So we have now enough scientific evidences to believe by this qualified and believe and practice by the qualified doctors that this is a authentic medicine. These physiological techniques are authentic medicine, and that is established by the scientific documentations. So if you look in the recent history, how this old concept has come back to a new, and it is taking a new shape, and it is because of the huge impact on socioeconomic and the disease burden. So that is why we have no, I mean, probably there is a requirement for this branch of medicine has arisen now. So in it is a James Rippe. He was the person who first wrote this, or rather edited this first textbook of lifestyle medicine. And the lifestyle medicine has emerged as a very rapidly growing branch now, and because of just I was telling that it is a now evidence-based behavioral intervention. So this branch of medicine is nothing but a evidence-based behavior. We have enough document now, and it is a behavioral intervention. What kind of behavior? We have to change the behavior of our food. We have to change the behavior of our physical activity, that is exercise. We have changed the behavior of our sleeping pattern, and we have to all 6 pillars. So this is the behavior. We have to change that those risky. We have to avoid these risky substances like alcohol, tobacco. So these are the behavioral intervention we are talking, and these behavioral interventions are now based on a proper evidence, scientific research. So that is the lifestyle medicine means. So which can prevent, treat, and manage the chronic diseases. So it emphasizes the preventive health care and self-care, because it has to be done by yourself. Not for the disease we go to doctor here and take pill or medicine. Here the medicine is within you. You are your own doctor. So it is a self-based and rather more preventive approach, curative. So it is less curative approach, more preventive approach. This branch of medicine provides more preventive approach. And as a result, now there are strong, this societies and curriculum is formed. And I'm happy that in India also such society is coming up. If you see in the American College of Lifestyle Medicine, it was founded in 2004. So 20 years back. British Society was found in 2006. So we are in fact lagging behind. They have developed curriculum. They are giving the degrees in lifestyle medicine. they are publishing the journal on lifestyle medicine, they are holding the conferences of lifestyle medicine. So it is now a very, very well established branch of medicine. So this was the cover page of the first lifestyle medicine textbook. So this part, the modern foundation of lifestyle medicine is based on strong scientific evidences. Dr. Kunal has elaborated is very. So these are the 6 pillars we are talking about the nutrition or food, the physical activity, the managing stress, Dr. Kunal has taken. So this part is all over. The social connection, restful sleep, also they are all touched. So I will be also just touching these pillars. So once again, just maybe it is superfluous to tell all those things. This high intake of processed food, sugar, unhealthy fats can lead to obesity, insulin resistance, chronic inflammation. It has been told again and again, and it can lead to the cardiovascular disease and certain cancers. Fruit, vegetables, whole grain. So Dr. Gagan has also explained the mechanism of this. And one key nutrient like omega-3 fatty acids, they are also known to improve the endothelial functions, they reduce the oxidative stress and decrease the systemic inflammation. And once they are reduced, then the cardiovascular disease prevention is easy. This part also was explained by Dr. Gagan. So I will just mention about this gut microbiome that is very important for the immune function and metabolism. It is not only has got role in digestion, but also very important in the immune function and metabolism, very well known. It has been explained with the mechanisms. The fiber-rich diet promotes the healthy microbiome. So fiber, the importance of fiber lies in many ways, but it has got a very strong impact on this gut microbiome. So for the proper immune response and nutrient absorption and inflammation regulation, the fiber is involved in all ways. So second pillar explained in a very elaborate way. So that because that is the main cornerstone of the lifestyle medicine. It enhances the cardiovascular, muscular, the bone, that is skeletal, metabolic and nervous system. It was explained in the morning. Reduce the risk of metabolic disease such as type 2 diabetes. Improve the function of the endothelium and help the vascular tone. And at the cellular level, the exercise induces the adaptation. Regarding the adaptation also, Dr. Varun has told how it can do effectively. Physiological basis, Dr. Varun has told about the BDNF, brain-derived neurotrophic factor, which is very important for the growth and survival of the neurons and essential for the cognitive functions and prevention of neurodegenerative diseases like Alzheimer's disease. Then regulation of the physical activity. Also that nervous system effect he explained about on its memory, anxiety and depression. It promotes bone health. Bone health has been explained. Moderate exercise also boosts immune system. And then here it comes, the sleep. Yes, sleep during sleep, the body undergoes some restorative processes, such as muscle repair, memory consolidation, and immune strengthening. So, sleep in the same way, I think whether you are active exercising or you are sleeping, having a sound sleep, their ultimate effect is almost same. If you see all those things, the proper diet or all the pillar, their main goal, they finally converge into simple one goal, that is the health, positive health. So, and the mechanism almost similar. All are promoting your neural health, nervous system health, brain health. All are promoting your cardiovascular health. So those diseases, and all are promoting your metabolic health. So these three health, metabolic health, cardiovascular health, and nervous system health, they can be achieved by through these all pillars. So then this branch of medicine focuses on these all 6 pillars. So similarly, sleep also doing the similar thing. Immunity, immune function, because inflammatory or pro-inflammatory products are crucial for most of the cardiovascular diseases or metabolic diseases. So that is why the inflammatory products are very important, and the immune system is very important, and sleep is one of the very important aspect which regulates the immune system. In some studies, especially in animal studies, sleep deprived rats which were sleep deprived, they start showing changes, metabolic changes, thermoregulation changes, uska food, appetite, temperature, these are, and they are the cognitive aspect, they are first affected, and gradually what happens, these are affected so seriously, but that does not become the cause of death. What becomes after 7 days, they dies. Why? Because of the infections. These animals are very much robust. They are not, the normal infective agents cannot infect them so easily, but they become very easily infected because their immunity is down. So finally, it has been found that because of the lowering of the immunity, because of the compromising the immunity, they are dying. So the immunity and sleep, they are very, very close. So low sleep reduces your immunity. And of course the other metabolic, cardiovascular, and nervous system diseases. So chronic sleep deprivation causes increased inflammation, increased oxidative stress, which in turn may lead to heart disease, diabetes, and neurodegenerative conditions. So finally, the pathology, if you see, more or less, only the path is same, but pathology is almost coming to the same. They converge in the same place. So they reduce immunity, increases the inflammatory substances, and they causes the metabolic disorder and cardiovascular disorder and degenerative disorder, neural disorder. So sleep disturbances are linked to various mental and neurological and metabolic disorders. Just we said that it can accelerate the onset of neurodegenerative disease like Alzheimer's disease. So mental health, anxiety, depression, we all have been telling. And then about this dysregulation of hormone starts. You know, this sleep changes this hunger and satiety, the ghrelin and leptin balance, the two hormones which are very important for the food intake regulation, appetite regulation, and these hormone disbalance provoke you to take more unhealthy, more fat and sugar-free food. And this can contribute to the overeating and weight gain and further exacerbating the risk of metabolic disorders. So that means the good sleep means good health. So we should take care of that sleep. At least 7 to 8 hours sound sleep, good sleep is necessary. It has been mentioned also by my previous speakers. So good sleep also improves your mood and good relationship. Good relationship is always good and positive, productive, give your productive results, positive results, and maintain a healthy weight also. Sleep helps to regulate hormones, just I told. It supports the healthy brain function, including the long-term memories, the consolidation of the memories, and then it lowers the heart disease risk, blood pressure, diabetes, stroke, obesity, all those things are and improve immune system, just repeating the same thing, and support healthy growth and development and repair cells and tissues from the wear and tears. So during that period, there are a lot of this, the growth hormone Dr. Kunal has mentioned. So sleep is very much essential. So if there is inadequate sleep, it is repeating on the same way that it increases the Alzheimer's disease, Parkinson's and dementia, increases the risk of fibrosis, increases the risk of CVD, obesity, body weight increases, the risk of cancer, risk of diabetes, risk of depression, anxiety and stress, increases CKD, bone pain, arthritis, risk of IBS or IBD, inflammatory bowel diseases, increases the risk of infection, that is the immunity. So almost every part, every corner of the health is being disrupted by disrupted sleep or the inadequate sleep. Now, how sleep affects, what is the mechanism underlying? So if you see that the sleep deprivation increases the inflammatory cytokines like interleukin 1, 6 and TNF alpha, the microglia function disrupts, the blood-brain barrier becomes poor, the astrocytes function becomes poor. So it affects the systemic circulation and the lymphoid tissue, so the system starts getting affected. There is decrease in the Th1 and increase in the Th2, natural killer cell decreased, CD8 and T cells, the decrease. There is decrease in obviously the antibody production, the B cells, T cells, antigen presentation, and the inflammatory mediators, interleukin 1, 6, and CRP and TNF alpha. So all these things finally leading to neurodegenerative changes, or it accelerates the neurodegeneration. It poses more risk of the cardiovascular diseases. It invites more infection because immunity is down, and then there is a more risk of cancer. So this is how the sleep is very, very, very important pillar in this circle. Sorry. So there is another model how it is affecting the sleep. What is this thing? Oh, no. Yes, this cursor. So, while this sympathetic nervous system, where this, when it is activated, the norepinephrine or this epinephrine are released, and these are the adrenergic beta-2 receptors, especially in the TLR4 cells, toll-like receptor 4 cells, and they finally, what they do, finally the CTRA, or this is called the conserved transcriptional response to adversity, that activation will lead to the pro-inflammatory gene expression and increased risk of inflammation-related disorders and cardiovascular diseases, cancer, and the major. So what is finally, because the genetic expression, these are all, the scientific evidence, supported by scientific evidences, that this finally, these pro-inflammatory products becomes an important factor for major depressive disorders, cancers, and cardiovascular diseases. So this is another model showing. So now coming to the fourth pillar, that is the stress management. That is the pillar which has been already dealt by Dr. Kunal. I will not go into the details. The same, this stress, just I have explained that how this stress can trigger the sympathetic nervous system and increases the blood sugar, and how the different inflammatory pro-inflammatory products are produced. So, and Dr. Kunal has said about this stress management by yoga, yogic practice, and how they are doing, he also explained, so I am not going to that. One thing only I would like to tell, that these relaxing techniques are actually activating the parasympathetic nervous system more. So it is trying to make the parasympathetic dominance. The parasympathetic dominance to heart occurs in athletes, we know, but here the yogic practice also increases. There are enough evidences that these relaxation techniques, they reduce the cortisol level, they reduce the heart rate, and improve the mood. So additionally, the relaxation technique can enhance the emotional resilience and improve the sleep quality and support the immune system. So in the various way, they are achieving the same goal. Fifth pillar, we all know the smoking and heavy drinking in particular are the key behavioral risk factors which has to be, and there are few who are also taking the drugs. This has to be avoided or managed or treated. So, sorry. And this last pillar, because I know that we are all late, so I am quickly concluding it with the sixth pillar, that is the social connection and their physiological impact. So social connectedness and a sense of belonging have been shown to influence the various physiological processes, including immune function, cardiovascular health, and longevity. And positive social relationship can reduce the level of stress hormones. Positive, so stress hormone, again, that is one of the major culprit in this cycle. And the social isolation and loneliness have been associated with the increased risk of chronic diseases, including depression and early mortality. So advantage of the social connection, if you see, it lowers the anxiety, depression, it increases the self-esteem, better brain health, longer life, and positive feedback loop. So physiological mechanism is one of this autonomic nervous system involving parasympathetic nervous system. And if you look at that, there is an association of heart disease and loneliness and social isolation of about 51%, stroke 32%, and 30%. So this is some factors. So isolation related health outcomes. So social isolation or loneliness, this can lead to the behavioral changes which are seen through diet, smoking, physical activity, alcohol use, or psychological depression, and physiological cardiovascular risk factors, inflammation and sleep, and cardiovascular health and brain health, they are affected. So lifestyle medicine, if you see the facts, so the alcohol and smokers number or use of tobacco and use of alcohol is huge, and which are beyond the limit. So approach of the lifestyle medicine for patients using the risky substances, there are some approach we can take. So psychologists take these approaches, and this is a SMART goal for avoiding the risky substances. We have in the morning we have heard about the SMART goal for diet. So what are the steps? And in conclusion, we can say that physiology remains the backbone of the lifestyle medicine, and understanding the underlying physiological mechanism is an important step for better management of lifestyle diseases, and awareness of lifestyle medicine among the healthcare professionals is needed. Otherwise, all the people will be only dependent on the pills and the medications. So the community awareness regarding the prevention and management of lifestyle diseases will help reduce the burden. So community awareness is I think very important need right at this moment. So I conclude my talk here. Thank you for patient hearing.
Thank you, sir. Thank you, sir, for this wonderful session. Now, I would like to ask the audience, do you have any questions? Anyone?
No more.
Okay.
Only question they have that when we are allowed to go out.
Now, I would request our respected chairperson, sir, to give his concluding remarks about the session.
First of all, I thank the organizer. First of all, I thank the organizer for giving me the opportunity to stand here. The presentation is very nice and deals with new subject, the lifestyle medicine, and the 6 pillars of physiological basis of lifestyle medicine is important. And Sarah said that non-communicable disease is increasing globally. It also increasing in our country also. And the last conclusion Sir has given, the community awareness. So I asked those who are present here had gathered knowledge about lifestyle medicine, lifestyle diseases, and if this knowledge is percolated not to the community, will be of harm. So behavior change communication is needed for community awareness and practice of lifestyle changes. So that should be percolated. Thank you, sir.
Thank you, sir. Thank you.
Okay, now I shall request our respected chairperson, sir, to felicitate the speaker by giving mementos and certificate. Sir.
Thank you. Thank you, sir. Thank you.
Now I shall like to call upon the stage Professor Dr. Prithvish Bhattacharya, sir, to give a token of gratitude to our chairperson.
Now, we'll have a short quiz session for all audience across the online and offline people who are listening online over there, and for the hall also. You will have 10 questions and 5 minutes. Within 5 minutes, you have to submit it. Scan the QR code here. Go through the questions and submit the paper within 5 minutes. It will not be accepted after 5 minutes.
Okay. So you can scan the QR code on your phone and start answering.
You can scan the QR code from your sheets also. You can scan it. You will have a link. Go to the link. You will have the question paper. Just tick the MCQs.
Only one correct response is there. There are 10 questions. Okay.
Surprise gifts are there for the offline people.
I hope everyone has done it. Does anyone had any problem in scanning the QR code?
Those who are sitting behind, you can also scan from your phone. Go to the Google or Google Chrome. See right side, there is scanner. Scan it. There will be a link. Click the link. A form will open having 10 questions. Put the right answers and submit it. Don't forget about the time. It will be only 5 minutes. After 5 minutes, no submission.
Time देखे नहीं अच्छा?
I think few of you has got through some problems. After scanning the code, you will have a ad that is automatically coming on your phone. Just skip the ad and you will have the questions.
Okay.
You will have that QR code in your batch group also. And the link. In question number 10, there are 3 options, 1, 2, and 3. Options are 4. In the question, there are a mistake is there. The serial mistake, 1, 2. After that, it will be 3, not 4. Right? The options are correct. There are 4 options.
Okay, so we end our quiz session. Oh. Results, yes.
Shortly, we will have the result. सबने किया? किसका नहीं हुआ? All of you, first prof student and nursing students also. Nursing students किसने नहीं किया ये quiz? आपने सब किया है? Good. And first prof? Okay. Let's see. The result will come.
Now it's time for the results. So.
वो सब हो जाएगा। अंदर इधर डाल दीजिए। अभी मैंने फॉर्म को ओपन कर दिया था so that you should not get stuck, but those who have submitted late, abhi you see, and sorry, the names and all will be displayed, but it's not a problem, don't feel bad. abhi isko control P karna hai. ठीक है, अभी इधर सब दिख रहा है. ओके, सो सबसे पहले अमृत सागर, या अमृत सागर गॉट 9.
अमृत सागर,
अरे
okay. Sir has come first.
ठीक है,
So give a big hand for sir.
लेकिन सर को हैम्पर नहीं मिलेगा, हैम्पर आप लोगों के लिए है.
Hamper is only for students.
So Preet Singh, next is Preet Singh.
Preet Singh.
Let me see if anybody else has got 9.
नहीं, second 8.
So Preet Singh, among students, Preet Singh
No,
comes
wait.
first.
Shreya Suvarna. Who is Shreya Suvarna?
Shreya Suvarna.
Online के हैं क्या? यहाँ कोई नहीं है Shreya Suvarna, right? You can read your name, right?
Here, Shreya Suvarna, 26.
So again ये online के हैं तो let me go through. एक और 8 नंबर है खुशबू, लेकिन ये सेकंड नंबर पे होगी, बाद में सबमिट किया तो 8 नंबर के 3-4 स्टूडेंट्स हैं, 38 तक 8 नंबर है। प्रीति जानी ये 3rd पोजीशन है, तो अभी कोई 9 नंबर नहीं, अभी टाइम एक्सीड हो गया, तो ऊपर से आते प्रीत हैज गॉट फर्स्ट प्राइज।
So Preet first. Preet, come on the first row.
Preet, no, you can come on the stage.
Come on the stage, Preet. Baat mein.
Sir. नहीं तो आप लोग दीजिए, अच्छा लगता है ना सब देते हैं। एक मना सर को बोलो। ओके, कांग्रेचुलेशन प्रीत, ये हट गया। ओके, हाँ ये रहने दीजिए, अभी 2nd, 3rd, 4th, 5 अनाउंस होगा सब।
So first prize for our quiz is going to Preet Singh and given by our HOD and Professor Dr. Malay Vikas Mandal sir.
Very nice.
Give a big hand.
क्वेश्चन टफ थे, 8 स्कोर कर लिया। नाइस,
Very good. Now it's time for the second prize.
नहीं ठीक है सर, सेकंड प्राइज इसको कवर करके लेना था लेकिन किया नहीं तो कोई बात नहीं। नेक्स्ट सबको 8 नंबर मिले हैं, 7 वाले को तो नहीं मिलेगा। नूर विरडी,
Noor Viridi. Please come.
यार पूरा नाम बता दो इधर आकर के। नाम का भी तो मैंने डाला था, नहीं नाम का नहीं था। Give him the mic to tell his name.
Tell your full name.
Palhar Noor Singh Virdi.
Okay. So congratulations to you. You got second prize. Please give him the hamper. Second.
Dr. Payal Sarkar will give him the second prize. Give a big hand.
Shreya Suvarna is online, so she will not get. Next is another 8 here. Khushbu Mehta.
Khushbu Mehta.
Volunteer तो नहीं है ना? वो भी online है।
She is online.
अच्छा, कोई और एक और 8 नंबर का था। ये डॉक्टर प्रीति जानी, ये भी ऑनलाइन वाले हैं। ओके, नाउ कमिंग बैक अप, फिर से 7 नंबर वाले को देखते हैं। 7 नंबर वाले ये शेवाक, क्या नाम है भाई? शिवाज खांगुरा। शिवाज खांगुरा, प्लीज कम ऑन स्टेज।
Shivaj Khangura. Come. I think Shivaj is popular. Come.
हाँ, 5th तक। And next is Shahid Raja. Shahidi. She's here. Shahidi Raja. शाहिद, आ जाओ शाहिद। इधर है क्या? नहीं है।
Come. Shivaj.
शाहिद इधर नहीं है। ओके।
Third 2 था ना? Third 2 होगा।
हाँ, जोगिंदर सिद्धू इधर है। जोगिंदर सिद्धू एक ही है ना? थर्ड दिया ना?
थर्ड है ना वो, थर्ड फोर्थ फिफ्थ।
So Shivaji comes first, comes third, and is given by Dr. Muhammad Faisal.
शिवाज खांगुरा इज देयर?
शिवाज,
वो शिवाज है। अब उसके ऊपर कोई और था ना?
ये 8वां प्रीत वो तो
नहीं नहीं वो नहीं वो नहीं। ओके, शाहिदी इज नॉट देयर, शाहिदी इज नॉट देयर।
शाहिदी राजा।
ओके, ये है जोगिंदर सिद्धू नॉट देयर, डॉक्टर जोगिंदर सिद्धू सम ऑनलाइन पार्टिसिपेंट।
कोयल,
ये क्या कोयल सीके?
ईमेल koelck@gmail.com।
इधर नहीं है। ये है चैतन्य खुराना। यस,
चैतन्य खुराना। Are you people copied each other? I think first, second, third all are coming from that two row, right?
क्या क्या जादू
It's
किया?
a collective effort, I think. Yeah.
नहीं, so this is the consolation prize for the fourth position.
Yeah.
टीम वर्क किया है कि एक मैं क्वेश्चन ढूंढता हूं, तुम दूसरा क्वेश्चन ढूंढो। हाँ, ओके। तो वन मोर चैतन्य के बाद एक और चाहिए। ये नवीद, कोई है नवीद एफबी?
नवीद ऑनलाइन।
ये क्या अश्विनी एलएनएमसी? नहीं है। विक्रम गौड़ा ऑनलाइन है। तो अब 6 नंबर, सबसे पहला 6 नंबर कौन है? अंजलि।
अंजलि, हाँ।
यस,
अंजलि कम। गुड।
ये इसने बिल्कुल अकेले काम किया है, नो टीम वर्क।
He breaks the NATO network. Anjali, consolation prize.
So those who have not got prize, no problem. You must have learnt a lot during the whole day. And this is the end of the session. We have one poster presentation. So all of you can leave. Attendance हो गया ना? Yes. मैंने आपका काम तो नहीं कर दिया ना, कुछ बोलना था।
आपका कहाँ पर है? मेरा है यहाँ पर नहीं है।
परसदीप कौर। नैन्सी कुमारी। Dr. Shashi Bhushan, resident, Department of Physiology. Dr. Payal Sarkar, Assistant Professor, Community Medicine, MGM Medical College.
Dr. Arup Mandal, Assistant Professor, Department of Physiology, MGM Medical College. Mrs. Astha Patel. Miss Astha Patel. MSS लिखा हुआ.
Sahajpreet Kaur. Shayantoni Malik. Amrita Gupta. Himani Singh. Manpalak Jot Kaur. Mr. Jagandeep Singh. Thank you, sir. Thank you, all of you.